coming today. The meeting is going to be recorded, so if you're not comfortable with that, feel free to go ahead and hop on out. For those of you in person, we will be having food dropped off at about 12:30 or so. So once the food gets here, just go have at it. Don't feel like you have to be like polite and wait. So yeah, so this is a presentation that, or workshop I'm going to put on. It's about LGBTQ plus considerations in counseling. So I know we have some people from different disciplines here. I know we have some psych people and some social work people. So this training and workshop is going to be mostly geared towards like a clinical focus, right? But I try to incorporate some other things in there that might be either important for research or for like patient or client advocacy as well. So if you guys have any questions, like program specific questions, I'll do my best to answer those. Feel free to ask away. So a little bit about me. Oh, before we get started, I'm very nervous. So if you see me smiling a lot, I'm so nervous that I put a speaker note in there to say, you're nervous. So just bear with me. My name, for those of you who don't know me, my name is Kinsfather. My pronouns, let me move this out of the way for us all. Ooh, you're me in the corner. My pronouns are he, him. I got my bachelor's in psychology from UCLA with honors. I do include that because it was very hard to do. I also have a minor in LGBT studies. I always forget to include that, but I did do it. And then I'm currently working on my master's in marriage, family, and child counseling, right, in progress. We're hoping for a May completion. So in addition to these wonderful accolades, I also done a lot of work in organizing in the LGBT community. So I was born and raised in Fresno. I got involved in like youth groups and like leadership like opportunities here in Fresno. I lived in LA for about 6 years. And so during that time, I worked for 4 years at the UCLA LGBT Campus Resource Center. After that, I also worked in UCLA's Office of Equity, Diversity, and Inclusion. So talking through things like identity, equity, diversity, and stuff is very near and dear to my heart. So I wanted to do this workshop for everyone because I think this is a community that often people are really scared or apprehensive to work with, even with like really good intentions, right? And so I wanted to maybe support people in that process, right? Any speaker notes other than I'm nervous, right? First, I thought we'd start off with a little icebreaker, right? I was very proud of this picture. So for our icebreaker, if you could do your name, any pronouns, if you don't have any preferred pronouns, feel free, you don't have to include that. What program or year that you're in, and then what is a moment you're proud of? For those of you on Zoom, I'm going to ask if you'd like to join in on the icebreaker, go ahead and just drop it in the chat. And after I finish with the people in the room, I'll come and read your guys' off the chat so that you guys are included, okay? So I started. Why don't we start with you, gentleman in the front?
My name is Andy, pronouns are I'm a first-year master's student for the Federal Psychology program at Business Center. The moment I'm proud of is when I graduated also from UCLA this summer. I was pretty excited. I never thought I'd be just going to be in that school, but it's very much like a childhood film. I have this aspect of going very much.
Hi, I'm Maddie. I'm in the MFT program. Should be graduating in May. A moment I'm proud of. I don't know, that's a deep question. Yeah, I guess getting into program, that was good. Yeah.
I'm proud of you for that.
Thank you.
My name is Alex and I use she, her pronouns. Related to school, I guess I'm proud of being in the final semester. I'm really proud of I was really excited to come see you today because we talked a lot about how parts of the program lacked inclusion of the LGBTQ plus community. So I'm super thankful you're willing to provide this for us. I'm really proud of you for doing it.
I appreciate that.
Yeah.
I'm Hannah. I use she, her pronouns. I'm in third semester of this program. And then something I'm proud of, I guess, getting through my first year in the program.
Hi, my name is Ash. My pronouns are she, her, hers, and a moment I'm proud of. maybe it would be like, I'm someone who's kind of afraid of trying new things, especially when it comes to like physical, like sports, or just anything that requires agility in any way. So when I started to rock climb 2 years ago at Metalmark, that was a proud moment for me, yeah. Like, kind of got over my fear of falling. Yeah. Mhm.
Hi, everyone. My name is Jocelyn. My pronouns are she, her, hers. And I'm part of the SAC program. I think everyone can speak in MFCC. But I'm proud of this being my last semester. I'm finally done. So that's something I'm proud of. Hi, everyone. My name is Danielle. My pronouns are she, her, hers. I would say a moment that I'm proud of is probably also getting into the program because I got in and I was just like, oh my God, I'm accepted. Very proud of that.
My name is Arsh. My pronouns are he, him, his. I'm in my 4th semester of the MFCC program. The moment that I'm proud of right now, seeing Aaron stand up there and present for us.
My name is Arcia. I'm not actually in the program. I just wanted to know more about this topic, which is why I'm here. I'm a nurse practitioner that serves the pediatrics, and I wanted to get to know more because it's such a sensitive topic. Moment that I'm proud is to do what I do today. Yeah.
Hello, everyone. My name is Chewy. Pronouns are he, him, his. A moment to be proud of, I guess it would be the same as everyone else getting through the master's program.
My name is Charlotte, pronouns she, her. I'm in MFCC program as well. And I would say my most recent proud moment was finishing last semester, because that was really tough. It was just a lot last semester. And I remember the night of our last final, just feeling like, oh my gosh, I'm amazing.
Hi, everyone. My name is Lindsay. I'm in my 6th semester of the Clinical Rehab program. I guess a moment to be proud of is making it this semester into internship and being accepted into my first choice of agency, working with the population health and workplace. So, yeah, that'll be it.
Esther, my pronouns are she, her, hers. And the moment that I'm proud of, honestly, like it's just the same thing that I thought of is really just getting that notice in the mail that I got to that MCC program. So, yeah.
Hi, I'm Carrie, she, her, hers. Everybody's sticking with the program. I am so happy that I'm almost done. That's a proud moment, was like paying that last tuition for my final semester, being like, yeah, I never have to do that again. And yeah, super happy to be here today, and I'm also very proud of you. Oh.
So everyone in the room wants me to blush. That's fine. I did not mention a moment I'm proud of. I'm very proud to be here, right? I mentioned this to Arch on a whim last semester, and I'd only seen faculty present. So I was like, there's no chance, you know? And then he just sort of pinned me down in January. He's like, how does this date work for you? I said, what date? And then I was like, oh, he's serious, really wants me to put this on. So this is a community that's very like near and dear to my heart. So I'm very proud and excited to be putting this on for you guys. So I did want to read some of the chats that we have for everyone. So I want to make sure you guys are feeling included. So I have Marilyn here. Her pronouns are she, her. 2nd year, she's a proud moment is that when she got into the MFCC program, right? Thank you for being here, Marilyn. Right, we also have, I believe that's Zaida. If I mispronounced that wrong, let me know. Zaida is getting their master's in clinical mental health counseling. They're in their 2nd year at Palo Alto University. They're proud of learning bird calls super quickly, as I just started bird watching 2 weeks ago. Yeah, you know what? When we go to questions here, Zaida, you're gonna have to share some bird calls with us. And then let us know what you're saying, because I don't speak bird. And then her pronouns were she, her, or Aya. Thank you for coming, Zaida. We also have Madeline. I hope I'm saying that right. Goes by Maddie. Pronouns are she, her. She's in her first semester at MFCC here at Fresno State. And a moment that she's proud of is making career change and getting into the program. It's really awesome, Maddie, and thank you for joining us today. Wonderful Danielle Rose over there, a moment that she's proud of is getting into the program as well. You'd be surprised, a lot of people don't get in or get in on their second or third try. So you guys should be really proud. It's a very cool program, right? Thank you for being here, Danielle. And then that first chat is me, so we'll ignore that. Yeah, so thank you guys all for being here. And I want to do highlight, right? We have people from psychology, we have people from clinical rehab, mental health counseling. I know there's a social worker in there because I saw her. So we have people from social work. We have a wonderful nurse practitioner with us today, right? Someone from the student affairs and counseling program, right? So we're all coming from some different disciplines, right? I know a lot of us are MFCC, but a lot of us are just, how can I better support my patients, right? How can I better support students that might come into my office, right? So again, I really want to encourage questions from you guys, right? There's a lot of stuff in my head that I was like, oh, I want to touch on this. I want to cover that, right? And it's impossible to do all of that in 2 hours, right? So what I really want to encourage is I want you guys to ask questions. If there's anything at any point in time, you're like, I want to know more about that, or I'm just interested how that might apply to my field, things of that nature, please ask. Because I want you guys to get out of this something, right? If it does seem like it might be an involved question or something that requires a bit more thoughtfulness, then I might say, oh, like, let's say that for the end, just so I can really give this question like the attention I think it deserves, right? Sound good with you guys? And people in the chat, if you want to just drop a question in the chat, I have some wonderful people keeping an eye on the chat for me, hopefully. And so if I don't catch it right away, we'll circle back, okay? So first thing I want to do some objectives, right? What's the path forward for us? My overall hope here is to empower all of you guys and help build your confidence and competency when working with this population, right? To that end, my first objective is I want to equip you guys with some language, right? Language is really big in our community. I don't know exactly why, but I think that people can get tripped up on that a little bit, right? I don't want to say the wrong thing. So I'm going to try to give you guys some language, and this is just a tasting. This is just a little amuse-bouche, right, of what is much larger, and we just don't have the time for today. The second objective is I want to provide you guys with a framework and some potential directions when working with these clients, right? Certainly, there's a lot of different theories that you can use. There's a lot of different experiences you might bring with working with LGBT people. So some of the frameworks I'm going to provide are just, again, some possibilities or areas that you can go in with those, right? And then last objective is to give you guys propose some of the unique issues that this community might face, right? You're going to find actually, despite some of these issues being kind of unique, there's going to be a lot more overlap with stuff that you already see, right? So we'll touch on that a little bit as well. So table of contents, we're gonna go over introduction, like I said, common words, language definitions, look at some of the research, what does the literature say, some of the themes, and I actually do have some vignettes here at the end, right? I have a combination of some provided by professors from, inspired by patients that they've seen. There's 1 or 2 that was kind of wrote in there, or that I wrote that I put in there. And there was one from a previous comprehensive exam. So any of you taking comps, right? This might look familiar to you. It's just something you might see in the future. We got some more chats. Let me just see. Oh, emails. Great. Thank you, guys. All right, let's go ahead and get started. So first thing I want to start with is some common words and what they mean, right? So what I'd like to do at this point is everyone who came in person should have a set of flashcards with them, right? So green is going to be something you hold up if you feel kind of comfortable or you're like, I think I've got this, I feel pretty competent, right? Yellow is going to be something you put up if you're like, I would want to try and I want to give it my best shot, but I'm a little reserved or I'm a little, worried about some things. And then orange is going to be a red light, right? This is if you're sort of like, I would not want to work with this person. Either I don't think I do them justice, or I just am really racked with nerves, right? Magenta, which you think is red, it's not. Magenta is, if at any point you have a question, right, and you're like, I don't know that I want to ask this in front of people, I want to encourage you to write it down. You can just come put it up here at the end. We can go over them. If only one person does it, I will not read your question in front of people and put you on blast like that, right? But if we get enough of them, I'm happy to read them and go over them in the questions portion at the end. Just if you're like, I don't feel comfortable asking this, right? I don't want to embarrass myself or look ignorant or anything like that, right? So 4 flashcards for you. Those of you in the chat, feel free to just pop some answers into the chat as well. My first question is, what is your level of comfort in working with like a couple or a family, right? Just in general. I will go ahead and put yellow, yeah. These answers may surprise you guys, right? So we've got some yellows, we've got some oranges. I appreciate that honesty. We've got a very ambitious green back there. No, I love it, orange. Own it for sure. Right? So we all have some reservations, right? We'd be a little nervous about that, but we'd want to do our best, right? We'd still try. Next question, what about individuals with faith or spirituality-based concerns, right? Maybe I'm having a crisis of faith right now. Yeah. I see some greens, I see some yellows, and I see some oranges, right? This would be an orange for me. This would be hard for me, right? I appreciate that. What about working with individuals who have LGBTQ plus based concerns, right? Either struggling with their sexuality, their gender, or something related to that. Yeah, we got some greens, we got some yellows. We have a mix of a green and yellow, and we have an orange. I appreciate that. I'm not gonna put you on blast, but I appreciate that honesty, right? I myself would be a yellow, right? I do this for a living, right? I live it every day. And even I would sometimes be nervous, right? Because I don't want to get it wrong. Or I don't want to think I know it all. Just because I live it doesn't mean I know how you live it, right? So I would be a yellow with that. LGBTQ plus couples or families. What's your level of comfort if you an LGBTQ same-sex couple presented to you, or same-sex family with a kid, right? Orange, yeah, there's some oranges in there, and there's some yellows. Yeah, that would be a yellow for me too. Yeah, anyone green with that? Anyone feel like, I think I got it? Okay, I love how honest this group is. Huge strength. I'm a strengths-based person, right? Yeah, I would be a yellow. Just a lot of things to navigate, right? I don't want to keep kiddo in mind, but I want to keep family in mind, right? Last one for you. I just came up with this last night, right? LGBTQ plus individuals with faith or spirituality-based concerns, right? How comfortable are you guys working with people who are LGBT identified and come in saying, I'm having a crisis of faith, right? I don't know what religion means to me, right? Yeah, orange and yellows. This would be a big orange, right? Spirituality scares me in general. And then how to navigate that with that identity group, I think would be hard for me. So we have a lot of yellows, a lot of oranges. Oh, look at the chat here. Let me see what. Yeah, some oranges, some yellows. Ooh, we got a green, Zaida. I appreciate that confidence. Yeah, so it seems like overall, right? A lot of us want to do our best. Some of us are, I'd be really worried to work with that, right? Either because I don't want to mess up, or, I just don't know enough, right? We're gonna turn all those oranges into greens. No, maybe not, right? But if we turn some oranges to yellows or some yellows to green, that'll be a success, right? Again, my hope is not that you guys are gonna be an expert. I'm not expecting you after this session or after this workshop to be like, I'm gonna put on my own, right? We're learning here. We're all learning together. My hope is that you'll start to feel more comfortable when people come to you with language that maybe you don't recognize, right? So I had a patient the other day who came in and said, I identify as uranic. I said, who? I've not heard that. I don't know what uranic means. And so I asked them, well, what does that mean? I'm not familiar with that. And they helped explain it to me, right? So again, you don't need to be an expert on this, but if you've heard it once, your patient comes in with it, you're like, gosh, what does it mean to be asexual? I don't really remember, but it might jog a memory for you, right? Or when they start sharing, like, I've heard about this before, right? This is not brand new to me anymore. It's not as scary, right? Also, this is my bad. I might use LGBTQ plus or queer interchangeably. They're not necessarily interchangeable. That's my bad habit, right? We'll talk a little bit more about queer here in literally like 2 or 3 slides. So why is language important? We talked about this being really important for our community, but just in general, right? We're gonna be kind of philosophical. On one end, language helps us understand, right? Words mean things. We communicate using words or other forms of language like sign language, written language, right? This helps us understand what we're talking about. And another way, language also reflects meaning, right? A lot of these words and language that we use is very laden with value, right? Very laden with meaning in it. Sometimes we don't always pick up on it, but oftentimes we do. So I might say something in my community and they'll kind of pick up on that, right? And sometimes I'll say it to someone else and they'll be like, I don't really get it, right? There's some nuance there that might be missed because there's value that's added to that. Language also helps people define their experience, right? So through language, individuals can say, oh, this is like part of who I am, or this is part of my experience. To that end, language can also empower, right? So there's a lot of ways in which we want to encourage our patients to define their experience because there's power that comes with that, right? This is especially true for a community that has historically lived in secret, you know, been pushed to the sidelines, been made to kind of hide part of who they are. So to be able to use language to claim that experience can really be empowering. On the other end of that, language can really disenfranchise an entire group of people, right? So this is a community that I want to remind a lot of us has been heavily pathologized in a lot of our mental health related fields and healthcare related fields, right? We'll see some of that language here in a bit, but I just wanted to kind of mention, right? In the same token that language can empower people, it can also really harm people, right? On not just an individual level, but even on a macro level, right? In terms of how we create policy. You hear me say that a lot because I think that it's important to recognize how things at this larger level are still impacting people on their day-to-day, right? So some basic language, some of you guys may already know some of this stuff, just in general, right? What does sexual orientation mean? Someone's sexual orientation is who is it that they're attracted to, right? It's usually linked to attraction, but it can differ sometimes from behavior, right? We won't go too much into nuance into that because this is baby's first training, right? So for these purposes, right, we're looking at sexual orientation is who is it I'm attracted to? Who is it that I want to be in relationships with, romantic, sometimes platonic, right? But and then we'll get into some specific orientations. Gender identity, right? Gender identity is how an individual identifies, right? I identify as a man, and you know, other individuals might identify as a woman. Some individuals don't identify with those two things. Some people, that sounds like really crazy out there, revolutionary kind of thing to say, but some people are, I don't really ascribe to being a man or a woman, right? Again, we have terms for that. Oftentimes, gender identity is related to or linked to how someone presents themselves. I'm dressed very masculine today, look at me. But I also have earrings on, right? Depending on the time frame you're looking at, earrings might not be considered masculine. I'm not going to take them off. I'm going to keep them on. They're really cute. But it may be different, right? So someone may present a certain way, and you might have an assumption about what their gender is, and that assumption might be wrong, right? I don't want people to feel bad about that. I just want them to acknowledge it. Because if you are wrong, oftentimes someone will correct you, and you just take the L, right? Oh, okay, I didn't know that. I made an assumption, and that's not a big deal. We can all own up our mistakes. Or even better yet, like I asked us when we all introduced ourselves, ask someone what their pronouns are, right? It's a pretty good key as to how someone identifies. And going back to language, that kind of simple act has been pushed a lot lately, and I think people forget why. For LGBT people, we often look for signals or signs that someone is either safe and affirming or not. Asking someone their pronouns is a really great and easy way to kind of signal, hey, I'm open to that. Even if I don't know the best, just that simple act of asking someone's pronouns, many people in the community will recognize that as that's an ally. That's someone who's trying, even if they don't even know what my pronouns are or what that means in its entirety. That's an act that you guys can incorporate into your things, right? If you don't do it, if you miss the mark, that's okay, right? We have client forums where we ask that. If an individual doesn't want to give their pronouns, that's also okay, right? Okay, I respect that. And you just move on. But for the community, that's a big signal for some of us. Next one, sex assigned at birth. You'll hear this a lot. So this is when you're born, right? You come out to your mother's, her areas, her bits, you know, or C-section, right? Someone looks at you and they assign you a sex when you're born, right? Typically they look at someone's genitalia, right? I could do a whole training on this, but that process is not actually as clear cut as you would think it is, right? Oh, you're either going to see a penis or a vagina, and it's either a man or a woman, right? Actually a really long cascade of events that happen from conception all the way to birth that can cause someone to not present with just a penis or a vagina, right? Took a whole class on it undergrad, like I know what I'm talking about. It's really interesting. Again, we won't have the level of detail here to really get into that, but just know that someone's sex assigned at birth sometimes can differ from their gender identity. We often think of this as a one-to-one, and it's not, right? So I might be assigned male at birth, but decide I identify as a woman or as non-binary, right? So just something to keep in mind. The last thing, we talked about pronouns a little bit. Pronouns just take the place of a noun, right? He, him, she, hers. Another one you might hear commonly is they, them, right? There's also some other pronouns that are a lot less common, but you might see them come up. Again, we just want to respect our patient's language, the language they're using. So if someone comes up and says, oh, my pronouns are they, them, you know, not really our place to say, well, that's grammatically incorrect. It's not. You can look at the grammar, and people use they, them as a singular pronoun all the time. But also, what is that communicating to our patient? You want to now challenge them and say that. Probably doesn't make them feel very welcome, right? You guys ready to take it up a notch? Yeah, okay. Any questions from the chat? I'm not ignoring you guys. Just drop them if you have them, okay? So there's this acronym that we throw around, the alphabet soup. Everyone loves it, everyone hates it, right? I want to hear from you guys if you can guess what some of these letters mean. And if you do, there might be a chocolate in there. I'm a terrible thrower, right? So if I don't get you, just let me know and I'll come back and fix it. Anyone want to guess what that L stands for? Lesbian. Awesome, Alex. Hope you like this. So yes, L stands for lesbian, right? A lesbian is usually a person that identifies as a woman who's attracted to other women, right? Some of you may be familiar with this, some of you may not, right? But it's an identity that a person might hold. And I want to take a guess at the G. Danielle. Yes, absolutely. Speak up, girl, you got it. Yeah. So the G stands for gay, right? That's me, I'm gay. So gay is typically for someone who either is a man that is attracted to other men, or also we use it for women as well who are attracted to women. It means you're attracted to the same sex, the same gender, right? But I will say, gay gets used for both men and women. Lesbian doesn't really get used for men, just FYI. So they're not, not two-way street like that. And then guess what the B stands for? Come on, I got something in it for you. You want to try? You got it, girl. Oh, cool. My God. Yeah, you're welcome. So bisexual, right? This is part of the community that sometimes gets kind of forgotten about. So sometimes you have men that are attracted to men and women, or you have women that are attracted to men and women, right? So they're bi meaning two, sexual meaning sexes. So attracted to both sexes or both genders, right? Ooh, we got some chats. Wait, let me see. Oh, Zadie said that's me. I appreciate it. I appreciate you identifying as bisexual and sharing that with us, right? Sometimes we don't always feel comfortable sharing that with people we just met. Anyone try the T? You go, girl. I got it. Yes, transgender. Very good. Yeah, Jocelyn killing it, right? So T stands for transgender. So this one is more related to gender identity. This is an individual whose gender identity differs from what they're assigned at birth, right? So I might have been assigned male at birth, but I identify as a woman. I would be transgender. This can sometimes get expanded to include other things, right? Including people that are gender non-conforming. We'll look at that here in a second, right? Someone who doesn't conform to that gender binary man or woman, right? Sometimes that's included and lumped in with trans, and sometimes it's not, right? If you have any questions, again, let me know. Because I forget, I do this all the time. So sometimes like, you guys know these words. Some people might not. Curious if anyone knows what the Q stands for. It's a hard letter. I almost gave it away. Do you know what it is, Miss Carrie? Can I call you on you? Yeah, there you go. Oh, God. Okay.
You got it.
No, you didn't get it. That was on me. I'm very gay. Gay people can play sports. I cannot play sports. The Q stands for queer, right, Harry? Awesome job. Queer is really kind of this umbrella term of anyone that doesn't meet what we would typically expect, right? Straight, what we call cisgender. We're gonna look at that here in a second, right? Queer is really an inclusive term. It's also a term that's very fraught, right? Our next slide is gonna be less nice words. And so queer is gonna come up back on that, okay? Now, this is a candy free for all. Because anyone want to take some guesses at this plus? Anybody? Yeah. It is not. It actually is not. But that's a good, it's a good transitioning is when someone transitions from one gender to another, right? So it's very linked to transgender. Not in that plus, but it's a great word. If you want another chocolate, let me know. What?
Intersex?
Yes, intersex. So there's an I in there. Stands for intersex, and we'll go over that right now. Ally's on there? Yeah, I was kind of shocked. I didn't know it was. The ally is on there. It's an A. Asexual is on there. Good job. Yeah, okay, well, I owe chocolates to people. Let me see.
Okay.
You sure? You want a chocolate?
Yeah.
And it's better not you to chocolate. Random stranger in the front, I've never met. Yes, ally and asexual is on there. Yes. Pansexual is on there. I did not know that one. I'm gonna throw it to you right now, Arsh. I'm not ignoring you. On the chat, yes, Zaida, I and A are both on there. Yeah. Intersex.
Challenging.
So I stands for intersex, A stands for both asexual and ally. We'll see that here in a second. Any final guesses? I'll reveal it. I'm not gonna be mean.
Aromantic.
It is not, funny enough, but maybe it could be.
Two-spirit.
Two-spirit is on there. Yes, good guess.
Two-spirit?
Two-spirit. Again. Is that all of them? Let me see. Okay, I'm gonna reveal. Big reveal. So what I found online, at least, LGBTQ QIP2SAA, right? That's a long one. I just had to include something in here, right? Don't get too hard on yourself because this has changed even for me. I had to look this up because I did not know what goes in that plus, right? It's a lot of words. So if you don't like get everything right away, that's okay. Again, you'll hear it here. And then when someone comes to you and says it, you'll be like, oh, I've heard that before, even if I don't remember it, right? That second Q is going to stand for questioning, right? So people that maybe aren't sure, right? Questioning, am I gay? Am I straight? Am I cis? Am I trans, right? The next one, I, intersex. Alex brought this up. I mentioned earlier that when someone's born, we often think male, female, penis, vagina, right? We look at their genitals and we make a distinction. Intersex are people that don't fall clearly into that distinction, right? And based on estimates, up to 1% of the population would actually be considered intersex. So it's actually not an insignificant portion. A lot of individuals don't know. Some that do know choose not to disclose. Some who do know don't really like this term, right? Kind of interesting, right? You'll see some of this language again is fraught. It's not agreed upon what's kind of the best practice or most common thing to use, but I does stand for intersex and we include them in here. P, pansexual, I think Arsh is what you said, right? Pansexual is someone who is attracted more to someone's personality, right? Their attraction to individuals is not based on gender, right? Some of us are like, is that not for everyone? Well, no, there's a term for it. You didn't know that, did you? 2S is two-spirit. Now, this one I have to look up my definition, right? So this is because I don't want to get it wrong. This is a modern term, current day, as of I think the 1990s, I want to say, that is used by some, though not all, indigenous populations or tribes. It's used to describe individuals who fulfill a third or alternative gender other than man, woman, male, female. It's often used for ceremonious purposes or someone who feels like a specific social role within that tribe. Again, another place where it's kind of fraught. Not all indigenous tribes use this. Not all agree that this is a real thing or that it accurately represents what it's trying to represent, right? But if someone comes into your office and uses that word, now you've heard it before, right? 2SA, asexual. I believe you brought that up, Jocelyn. No, Danielle. Oh, Jocelyn's next to you. Danielle, you brought up asexual. So asexual is one we don't hear of as often, but asexual is someone who doesn't necessarily experience sexual attraction, right? Well, how can that be? It just can, right? I'm not always sexually attracted to every person at every point in time. So some individuals might identify as asexual. I experience sexual attraction in maybe the way other people do. There's a term closely related to that called gray sexual, which is just used to describe individuals that experience sexual attraction at different points in time, right? Some words that are not on here that I wanted, oh, the other A is ally. That's some of you people are wonderful allies. These are supporters, people that may not be part of the community, but care and want to support it. So that might include some of you guys here and in the chat. Words not included in here, right? I said gray sexual, polyamorous. This one's kind of interesting. There's some debate about whether that belongs in this community. I choose to include it here because it's a different romantic configuration than what we typically see. So people that are polyamorous tend to engage in more than one romantic relationship at the same time. That's contrasted with monogamous, which is what most of us are familiar with, having one partner, right? Again, there's different configurations of relationships that can kind of be subsumed by polyamory, right? Like this thing of an open relationship. So we're monogamous, but we might, include other people in our relationship at different times. Again, don't feel like you have to know all the configurations. Your client will help you understand that if it's important to them, right? Another one, we talked about gender non-binary, gender non-conforming, someone that doesn't identify as a man or a woman. Cisgender, I threw that out there. Does anyone know what that means?
All of the, you identify as your birth.
Yep, exactly right. Yeah, so if you couldn't hear Alex, her, shared that cisgender is someone who their gender identity does align with what they were assigned at birth, right? So I'm cisgender. I was assigned male at birth. I identify as a man, so I'd call that cisgender. Essentially, it's anyone that's not trans or gender non-conforming. So it's kind of a nice little, parallel to each other. You might hear that used a lot. Heterosexual, we might all know this. We might not. Heterosexual is anyone who is attracted to the opposite sex. It's typically what you think of or see in relationships, right? But does not include all relationships. Any questions about this before we move forward, right? It's a big acronym. Again, I had to look this up. I looked up like 3 sources. What is included in that plus, right? So someone asked earlier about aromantic. I didn't see that included in there, but maybe some people do include it. But that is a word in the community. I'm not going to go into romance here too much today, just for the sake of time. But if you have questions, we can talk about that. All right. So here's some less friendly words. I'm not going to make you guys guess these. I'm not that mean. You might hear the word homosexual, right? It's typically been used to describe usually men, but sometimes women who are attracted to the same gender, right? We don't really use this word as much anymore. You might still hear it sometimes, but for the most part, it's outdated. And the reason for that being it's heavily pathologized, right? In the DSM, homosexual was a disorder that you could be diagnosed with. It was really seen as like something wrong. We don't really use it. Homosexual's best friend's transsexual, right? So earlier, I believe, Danielle, you said transgender, or maybe it was you. I'm so sorry, it was you, Jocelyn. Transgender is correct, or I shouldn't say correct, is preferred, right? Transsexual, again, for the same reason. It's outdated and it's heavily pathologized, right? It's like a diagnosis, like something's wrong. Oh, they're transsexual, right? So we don't love that word as much. We talked a little bit about queer, and this one, it really depends, right? I use queer all the time. And there was one time my dad, older man, about 55, 6, I forget. And I was talking to him on the phone about something. I was like, yeah, because I'm like I'm queer or whatever. My dad stopped me, he's like, don't say that. So what? He's like, Aaron, that's a really bad word. Girl, what? For some older individuals, right? Queer is really derogatory, especially our older LGBT people. My dad is not LGBT, straight, whatever, good for him, I guess. But even he was like, that's not a good word. Like, that's a bad word, right? Today, we tend to use it a lot more frequently. It's kind of a word that we think of being reclaimed by the community, right? So it's a word that has been used against us that we now use for ourselves to subvert some of that power that it holds. But depending on who you talk to, some people really do not rock with that word, right? So this is not meant to scare anybody. If someone shares that with you, right? I don't like that word. Hey, that's not like something that I vibe with. You just respect it, right? Okay, cool. Definitely. I know some people have different preferences. I have no issue not using that word, right? Again, kind of a catch-all term. So that's why it really depends. Like I said, I've been using it throughout this whole thing. So one that I see really commonly, sometimes people refer to like trans and gender non-conforming individuals as that thing, right? This is really dehumanizing. So if a person is trans, you don't maybe know what their gender is, you can always just like with genuineness ask, like, I don't want to misgender you. I just want to make sure I'm respecting like what you prefer. What pronouns should I use for you? Or what pronouns do you use for yourself? 9 times out of 10 people are going to respect that and understand that because you're making an effort. But sometimes we see individuals like, oh, he, she, it, whatever, it's really dehumanizing to call someone that because it is usually an object. It's not usually a person, right? Anyone want to guess some No, I'm not going to type these here, right? I didn't have the heart to do it. There's a litany of slurs. Some of them actually are really culturally specific. right? Again, I'm not gonna say them here. There's many I should not say, right? Would be inappropriate for me to say. We just really, there's not an incident in which I would encourage you to use that. You may get some individuals that come into your practice and they use slurs to identify themselves. We are not in the business of policing people's language. I've thrown out an F slur here or there in, company that I'm comfortable with. I was like, should I use it in the presentation here for shock? I was like, no, it's not appropriate, right? If your patient comes in and uses that word, we don't want to be like, oh, don't use that. Ooh, say something nicer about yourself, right? Respect what they use. You don't need to reflect that language back to them, right? That's not licensed to join in on the fun. I just want you guys to know slurs are just by default best to avoid them. If your patient uses them, again, respect what they use. If you're doing something clinical and it's connected to something like shame or like, internalized homophobia, you can explore that. But yeah, does that make sense? Okay. Arsh, you had a question. I love questions.
Yeah, so how would you say going about like navigating if it's someone using the F word in like a derogatory, homophobic way?
Yeah, that's a great, so Arsh's question was, how would you kind of navigate that in like a clinical setting? If someone did use a slur to identify, how do you kind of differentiate between if it's, self-proclaiming or if it's, self-deprecating, right?
Well, I'm asking if they did mean it in a homophobic way.
If they did mean it, how would you navigate that?
Yeah.
Man, that's really gonna be a clinical judgment call. I can't tell you the best way to do it. I would probably just explore with them, right? Based on your rapport with the patient, you may be able to leverage that in different ways, right? So if I have a good rapport with the patient, I might be a little bit more willing or bold in sessions like, that's not a particularly friendly word. I hear you saying that. And I just wonder where that's coming from, right? If it's kind of someone that you're just meeting, I'm not a big fan in session of policing language. So if I had, let's say, a conservative person that came in and really was saying that about someone else, right? I myself as a member of the community, I might let them finish saying what they need to say and then explore with them, right? Seems like there's a lot of hate here, right? Or it seems like there's a lot of strong feelings towards those members of the community. I heard you use this word that really isn't a positive word towards those members. I wonder what that's about, right? So it really is going to depend on your clinical rapport with the patient, what the situation is, what are they coming to you for, right? I have had, this is in my own personal experience, this is not in a clinical experience where I had like an individual that was not well and they were displaced and they were like asking me for money and I'm just a bleeding heart, I can't say no. So I was giving them money and they like said, oh, thank you so much. This insert slur here, like the other day didn't want to give me any money, right? Yeah, I could challenge that person in the moment, but this person is struggling, right? So I chose not to, right? If that was like a clinical example, right? I had a person coming to me for help, connection to resources and stuff. Me personally, I wouldn't have it in my heart to be like, don't use that word or I'm not going to help you. I'm going to assign you a different clinician, right? It's well within your right to do that, especially if you are a member of the community. For me personally, I would struggle with that. So I can't tell you what to do. It's really going to be your level of comfort and clinical judgment on that, right? Did that help? Yeah, okay. You want to raise up a card? Green, yellow. We have some chats. Calling in versus calling out, Zyda. Would the same practice apply with someone who identifies with neo-pronouns, which is more common with a younger generation and can include identifying as it? So Spring asked a really great question, right? Like we talked about it not being a great pronoun. There's some other pronouns that are just a lot less common, but if someone came into my practice and said, oh, my pronouns are he, him, she, her, they, them, it's, right? I would just respect that. I was like, okay, or whatever, if they just say it, do your best. And I would just be honest, like, I don't hear a lot of people identify as it. I'm kind of going to try my best to reflect that. But if I mess up sometimes, please give me some grace. I'll do my best, right? It's hard. There's not an exact formula I can give you. For the most part, my best advice would be respect whatever they come in with, right? This might be someone that identifies as it now, but decides later, like, maybe I didn't really connect with that the way I thought I did, right? Or maybe they do. Maybe for them, it's like, I'm going to call myself it because it's really radical and empowers me to do so. I'm going to call myself it before you do it, right? I'm going to call myself whatever slur before someone else has the chance to do so. There's power in being able to do that. Because if I call myself it, you're not going to hurt me by calling me that, right? So really great question, Spring. And Zaida, I liked the differentiation between calling someone in and calling them out, right? Especially clinical sense, checking in, right? What is that about? You know, you've used the word FAG 3 or 4 times, and it feels like when you say it, there's kind of some hate or some vitriol behind that, right? Whether they're a member or not. If they are a member, it might be like, you know, I know you've shared that you also are gay, so I just wonder where that comes from. And if they're not, just wondering, I wonder why that upsets you so much. Why does that make you so angry, right? So wonderful point, Zaida. Thank you for bringing that up. And good question, Spring. I hope I did justice to it. Maybe I didn't, but last category I want to go over, I'm calling these just others, right? This is some kind of coded language that I think gets used a lot. And this is really where most of you I trust to be pretty decent with LGBT patients. I'll just say that. This is where even like well-intentioned people might kind of slip up, right? So like I said, coded language that has other values. When we say things like, oh, like that's a lifestyle choice. Oh, they have an agenda, right? We've heard this, a gay agenda. I'm pushing it today, guys. Or that's just a preference, right? Other things you might hear is like, well, that might be your gender, that's not your biological sex, right? Or, oh, like, for trans people or even gay people, right? You can pass as straight, you can pass as a woman, you can pass as something, right? People wouldn't know by looking at you, right? Again, this language is very coded. A lot of us pick up on that stuff. You know, if someone uses words like that, usually even well-intentioned, I'll be like, thanks, right? Why is that? These words are often reductive, right? Reducing something, a person's identity, as just a preference or a lifestyle. They can be dismissive, right? Well, you are just pushing some agenda. It's not like a real movement, or your biological sex is this, so I'm going to dismiss what you identify as. And at last, it's invalidating, right? It's me saying, I know your experience better than you do, and I'm not going to respect that. Yeah, so just again, even well-intentioned people, those are some words that you might want to just try to start moving out of your vocabulary. Oh, I got a thumbs up. Thanks, Spring. I appreciate that. Any questions about these less friendly words? And we're going to move out of language for a little bit, if that's okay with you guys. Okay, I love it. Thanks for the thumbs up, Alex. I need that constant reassurance. I do. So some takeaways from the language portion, right? I know I blabbed a lot of words at you. If nothing else, I want you guys to remember, practice humility, right? I've been saying it, I'll keep saying it. If you come into a session, or you have a research participant, or you have a member on your caseload, right, that you don't understand a word that they use or an identity, right? If you approach them with genuineness and a willingness to learn and understand, I've done this work for over 10 years, 9 times out of 10, people are going to respect that. People are going to feel that. They're going to recognize this person is trying. You may be the first person asking them their pronouns. You may be the first person that is trying to learn more about what transgender means, right? Or what it means for them. So if you can practice that humility, I promise you, the majority of your people are going to understand that and receive that. Of course, there's always going to be some people that might not, but again, we don't know what happened to that person before they got to our doorstep. We don't know the life they lived before that, right? That may not be about you, right? And you would just explore that with them, right? It seemed like that really, really hit a nerve, where did that come from? My third point on here that I make is own your mistakes. Some clinical supervisors, it's funny, none of the professors in this room, so I'm like, no one can check me on this, but some clinical supervisors will tell you don't apologize, right? I'm not part of that ministry. If I make a mistake, even in session, regardless what it is, I don't mind apologizing. I have no problem just saying, hey, I think I got that wrong, right? Some of our clinical people, when you're summarizing or paraphrasing something, sometimes if patient's like, no, not really like that, I'm like, okay, sounds like I kind of missed that a little bit. I'm sorry. Can you help me understand that better? Same thing if I misuse a pronoun. Oh, actually, my pronouns are she, her, not he, him. Oh, I'm sorry. I didn't catch that, and I will make a concerted effort to do better, right? Not licensed to keep making a mistake. If you keep fucking up pronouns, then I'm kind of like, hey, that doesn't show a level of respect or care, right? But if you mess up and you make that repair attempt of, I'm sorry, like, I recognize the misstep, I think that would really go, do a lot for building that therapeutic rapport, right? And the last thing, encourage self-exploration and definition, like I've said already, like, allow them to define their experience, allow them to share their story with you. Don't assume that you know it, right? This is for me too. Because I'm gay, I don't want to go into a session with a patient and assume my gay is the same as yours, right? Any other points? All right, I think that's good. Does anyone need a break before we start about research? Bathrooms, get out of this hellfire. For those of you on Zoom, it is very hot. It's like 70 degrees in here or something. It's just 80. Yeah, it's obscene. Yeah. I see all these wonderful people fanning themselves. I'm like, I can't help. I wish I could. I did want to check in with cards, right? How are people doing? Green, I got this. This makes sense. Everything is really helping out. Yellow, okay, I just see greens. So we won't go through the awesome possum. No, I'm glad. I'm gonna do a lot more check-ins. It's just my nature. Space for questions. Anybody have any questions about anything we've gone over so far? Chat girlies. Okay, what do you guys say? Green and greens. I did in Maryland. Thank you for the input. I appreciate that. So I'm such a nerd, right? Any of you guys that know me on a personal level, I love research. It's just so cool. Someone did this, right? So I wanted to propose some ways that you can kind of conceptualize issues that LGBT people face, right? When I found some of this research, I was literally just like, oh my God, this is so, like, I geeked out about it. I thought it was so cool. So I'm going to share that with you. Take it or leave it. You don't need to take it. That's okay. Why do we even need this presentation and workshop, right? Why am I up here doing this? Not getting paid. Crane. Right? Because the research has shown consistently that LGBTQ plus individuals face poorer mental health outcomes than their non-LGBTQ plus peers, right? So we have some disparities in the community compared to other people. This part might not be as fun and cheerful, right? So I'll try to do my best to respect the level, the gravity of some of these things. I am curious, does anyone want to take a guess what some of those disparities are? What are some of these differences that we might see? You don't have to. I'm just curious. Arsh?
Well, we're talking about over pathologizing,
Mm-hmm.
how some sexual orientations were just viewed as like a disorder, pretty much, you know? So
Yeah.
it's like we weren't treating those individuals with validity in regards to the issues that they were facing, but rather we were just viewing their whole identity as an issue that needed to be fixed. You know, so imposing this issue upon them rather than taking them for who they are.
Yeah, I'm really proud that you mentioned that because I will mention it here several times. The identity is usually not what the issue is, right? And you have mentioned that historically this community in different ways at different times has been pathologized, right? Something is wrong that needs to be fixed. And if we can just find the right treatment or the right thing, we can fix it, right? There's history of using things like electroconvulsive therapy on people for their orientation. ECT can be a valid form of treatment for some mental disorders like depression and bipolar disorder, right? You wouldn't use that to change someone's identity, right? There's also other things we've talked about sending people to camps that aim to pray the gay away, right? Or help someone change their identity, right? The research is pretty solid on that that doesn't work and actually really hurts people, right? So, yeah, let's keep that in mind as we move forward with some of these disparities. Where is that coming from? Some of that's historical, right? There's a historical basis for some of this. Wonderful point, Arsh. Anybody else want to try to take some guesses at some of these disparities that we might see? Yeah, Charlotte, I really appreciate you sharing that. For those of you on Zoom, Charlotte shared higher rates of suicide, right? I'll pop the lid now. I have it later, but there's different estimations, but some estimations propose that LGBTQ plus people can seriously consider suicide or attempt suicide at 3 to 4 times more often than their non-LGBT peers. And just saying that, right? I feel myself getting like elevated, right? Like upset because it's just absurd, right? Someone's LGBT and they're 4 times more likely to take their own life. And it's, that's a huge disparity. So thank you for sharing that because that is one of the biggest ones that we see. Anyone else want to take some guesses? I'm sorry, this is not a joyous topic, right? But it is important. So some ones that I wanted to highlight here for people, right? Substance use and IPV. This one really interested me. So some of you might have different ways that you think about substance use. I often think of substance use as a way to cope with something else, right? It's a coping skill or mechanism that is maladaptive. It's maybe not serving, the patient being their happy, healthy self, right? It's not surprising for a community where there's a lot of stigma and stuff that there are higher rates of substance use, right? In addition, there's also higher rates of IPV. I found this really interesting. Even in LGBT relationships, there's higher rates that same-sex couples are engaging in intimate partner violence more often than their non-same-sex peers, right? It's kind of shocking. Charlotte, I just want to say, you called it suicide and self-harm, right? Higher rates of both for our community. Displacement and homelessness, right? Certainly being displaced, not having stable housing can lead to a myriad of mental health issues. And a lot of mental health issues can affect stable housing and someone's ability to maintain a job, maintain income, right? So we do see higher rates of that amongst our community. Last but not least, this is not every disparity that we see, but we do see higher rates of depression and anxiety, as well as other mental health disorders, right? PTSD. There's some research indicating that there might be higher rates of OCD in the community, right? So what do I want to say? What do my notes say? So these rates differ based on gender and sexual orientation, but across the board, they all indicate typically poor outcomes for minority individuals, right? Unfortunately, these rates tend to be higher for people that identify as bisexual versus just gay or lesbian. They also, for trans and gender non-conforming people across all domains, tend to have the highest. Alex. No, go ahead.
I'm not sure, just like access to healthcare in general, which mental health would fall under, would that kind of probably fall on the list as well?
That's a really great question. One of the statistics I didn't include on here, but I did see, I can't speak specifically to access. It's a big word, but one of the statistics that I saw from the Trevor Project, because they do some statistics every year, is that I want to say about 46% of LGBT youth report not engaging in mental health services, even though they thought they needed it. It might have actually been higher, I forget, but there is around half or more that report they don't engage in services despite saying that they need them. I want to say about 76% of people say that they think they need mental health services, right? So yes, I think the research would support that. It's about access, and maybe even if someone does have access, that perception of this clinician, this provider is not going to be affirming or accepting can be enough to prevent someone from going, right? That'll come up a little bit in the model we're about to look at. This idea of expectations or perception is going to come up again. But wonderful question, Alex. Did you have a follow-up?
Yes.
Yes, no, I love questions.
Do we see challenges within the transgender community with access to healthcare in the same ways that maybe those who identify as would be?
Yeah, I would say, I'm trying to remember, of course, I want to give you statistics, but there's a lot of numbers. My sort of anecdotal clinical experience stuff that I've seen is yes. I think the access tends to be harder for trans individuals because, again, a lot of times their needs around things like gender affirming care or transitioning or just ways to live better, fuller lives, they oftentimes get missed or they get pathologized or they get reduced, right? So in order to engage in certain aspects of gender affirming care, that's healthcare that helps people live the gender they identify as, typically there's some gatekeeping with that, right? In order to engage in what we call, historically was called a sex change operation, that language is kind of outdated, right? But it's a surgery to kind of help your body look the way that you envision it should look. You have to get a written letter from a therapist or mental health provider before they will consider doing that, right? That's still a practice today. And that's interesting, right? Because there's plenty of elective procedures that individuals can get without a letter. Same thing like hormone replacement therapy is another gender affirming activity that individuals can engage in. And we know in the news and the media right now, there's been a really big push to preventing that from people who are minors, right? Even though the research kind of supports that, it's helpful in terms of their long-term mental health, right? So my educated guess would probably be, yeah, I think the access is harder if you're trans or gender non-conforming, right? We're in a really interesting place historically where some of these issues are starting to come up and be more accepted and talked about. And so I see that push happening mostly for gay and lesbian people. I think bisexual people are kind of falling a little bit behind that, and then trans and gender non-conforming people are a little bit behind that, right? So moving forward for sure, but do I have, yeah, one of the things I have on here, we talk about is this term intersectionality, right? I didn't include it in the language portion, but it's this idea of when different identities intersect within a person, they create this unique gradient of experience, right? What does that mean? That means a gay white man, my experience might be different than someone who identifies as a Black gay man, right? That racial portion kind of affects the way that we both experience even being gay, right? Same thing for gender and sexuality. So individuals that identify as either trans or gender non-conforming, that typically affects the way that they can do things like access healthcare or find housing or find employment, right? I don't know if I have it on here, but in some states, it's sexual orientation and gender identity are not protected. They're not protected categories, right? Especially in some other countries as well. So yeah, thank you for the question about access, Alex. I bring up intersectionality because I just can't without leave this slide without mentioning of all the things that I've shared with you, they again tend to be harder for Black and brown LGBTQ plus individuals, right? So for instance, Black trans women and brown trans women tend to face higher rates of victimization than white trans women do. Trans people in general already face higher rates of victimization than other parts of the community. So we want to consider how people's different identities might be intersecting to be affecting the way they experience things, right? So I would be remiss if I didn't bring that up here. That's a whole other presentation, but I want to do a temperature check. How's everyone feeling, right? I feel a little hot beyond just the temperature, right? Oh, tee, that was on purpose. Everyone feel good to continue onward? I got a green, I got a fan, I got a thumbs up. Okay, okay. If you need to step out and take a break, it will not hurt my feelings. Please take care of yourselves, right? So this random dude, his name's Elon Meyer, right? And I was doing some research for a little project. And I was like, what is this guy? He keeps coming up in the literature over and over again. What is this minority stress model that people keep talking about, right? So Elon Meyer proposed this model as a way to explain why LGBTQ plus individuals face higher levels of poor mental health outcomes than their non-LGBT peers, right? His proposal, simply put, is that LGBT people face not just everyday stressors that we all face, right? Oh God, I gotta pick up the kids. Oh God, I argued with my partner. Oh God, boss is coming down on me at work. I'm not making enough money, right? These are things we all might face, everyday stressors. In addition to those, they also face these stressors that he termed minority stress, right? These are stressors that individuals face based on their group membership, right? So as Arsh mentioned earlier, he's very clear that the identity itself does not cause the stress, but it's typically being a member of that group adds additional stress on top of stuff you might experience every day. And that accounts for those poor outcomes, right? One big stressor, discrimination, right? So if I'm just out in the street walking around and someone yells the F slur from their car window, right? It doesn't make my day a lot better, right? That doesn't make me feel good about myself. I carry that with me, right? And that's one instance of discrimination, right? It could be access to housing. It could be access to a job, right? It could be access to healthcare, right? Or, you're watching something on TV and there's a queer character on there and whoops, they're dead, killed them off. It's a trope that they often say in media called bury your gays, because a lot of queer people in media, they die, right? That's the narrative that gets told to us. Certainly we know that those outcomes are there and no one knows it better than us. So seeing that is not heartening, right? So this model actually also, bless you, dear Arsh, is also used to explain why LGBTQ plus people of color also face higher prevalence of these outcomes, right? Part of that being stress, not just from being LGBT, but stress from also being Black or brown or of a different racial ethnic group, right? Those stressors are not additive, they tend to be compounded together, right? So it's not like 1 + 1, now you've got 2 stressors against you, right? It really would be almost like a multiplying effect. 2 + 2 is 4. 3 × 3 is 9, right? So this model also kind of captures part of that. I'm going to go into more detail, but this includes both internal factors, external factors, and what we mentioned earlier, these expectancy factors, right? So certainly part of this is the perception that these things might happen. So even if I go and I don't get a job, right, there may be a valid reason why I didn't get the job, but my expectation or my perception might be that they're discriminating, right? I go in, there's no queer people there, and I didn't get the job, probably because of me, right? Is that true in reality? It might not be, but that perception is what matters. If I perceive that to be there, that's what's going to affect my mental health. I'm going to be less likely to try for other jobs. I'm going to be less likely to try to engage in, more workshops if I think that it's already rigged against me, right? Fret not, because Meyer also proposes these things called stress ameliorating factors. It's a fun word. We don't hear it enough, right? Factors that will kind of help mitigate that impact, right? So, one that we know of is community engagement, right? LGBT members that are engaged in their community or have a community to rely on, they tend to face slightly better health, mental health outcomes, right? Now, this is not a fun picture. I think it's really cool, right? This is kind of his proposed model. I'm not going to walk you guys through all of it. I want to highlight this right here, right? You have something that happens and you have general stressors from that, right? You might also have minority stressors, right? These include, like I said, both events of prejudice, events of stigma, events of discrimination, violence, right? These stressors also include, like I said, expectations, having to conceal yourself, internalizing some of these messages that have been shared, right? And then up here we see some of those stress ameliorating factors, right? They include and are not limited to coping skills, coping patterns and styles, right? Social support such as community and individual, right? So you kind of see right here that mitigates that effect that stress has on people, right? It's a cool picture. So if you get time on your own to look up the article, it's a really cool article. I don't want to belabor the point, but I did want to just show you guys because I like how they look at it together. In terms of stressors, right, he mentions external stressors. That's, like I said, things like discrimination, stigma, acts of violence. He also mentions internal stressors, right? So things inside us that might be stressing us, right? One of the big ones he talks about is internalized homophobia or transphobia, whatever phobia, right? So me hearing thoughts that gay people are lesser and don't deserve to have certain rights, I start to internalize that. Individuals with higher rates of internalized homophobia tend to face poor mental health outcomes because there's this dissonance, right? I am engaging in these behaviors, but I think that they're bad, right? And that doesn't get resolved. It doesn't tend to help people do well. Last one, the expectancy stressors, right? Expectations that I will be hate crime, expectations that I will get called a slur, denied housing, right? Those expectations are also stressors, whether they happen or not. So whether I actually get the job or not, regardless of the reason, maybe my skill set wasn't enough or just there was a better candidate, right? But the expectation or the perception that I had was I wasn't good enough. They don't hire trans people, right? They don't hire gay or queer people, right? So that expectation of future discrimination is itself a stressor and accounts for some of those poor mental health outcomes that we see. So how do we use this model, right? How does this inform our clinical practice? Well, a lot of the research that's built on this model looks at things called risk factors and protective factors. If you've ever done like a suicide training, right? We've talked about some of this stuff before, right? What are some risk factors for poor mental health outcomes? And what are some protective factors, right? I'm curious if anyone wants to take a stab at any of what they think these might be. If it's not clear, a risk factor is just a characteristic or trait of an individual that tends to be associated with poor outcomes, right? Whereas a protective factor, which is why we got the green heart, tends to sort of help protect those individuals from those outcomes. They help relieve some of that stress or mitigate that effect, right? I'm curious if anyone wants to take a stab, just based on their anecdotal experience. I see Arsh raise his hand again. What can I do for you, Arsh?
I heard someone say strong community engagement.
Oh, I did say that, sugar biscuits. I did say that, yes. Strong community engagement is a protective factor, right? Social support. Danielle, it looked like you wanted to say something, but that's okay if you didn't. I thought I saw you thinking, okay. Anybody else want to take any guesses? I've got chocolates to just get rid of. It doesn't just happen at the end, by the way, but. So, okay, a follow-up question for you. Can something be both a risk factor and a protective factor? Alex, you're nodding your head. What do you think? Yeah. Can you think of an example of one that might be?
Trying to,
Yeah. Yeah.
feels like yes.
Yeah, right. Yeah. We'll look at some of these together then, right? Some risk factors, family rejection, right? People who face higher rates of rejection from that first social circle that they have, right? This is a big one. This is a really big one. And there's a big association with family rejection and poor outcomes. Internalized homophobia, which you mentioned, right? People that tend to internalize negative messages and beliefs and values about themselves, they tend not to do as well. Rates of victimization, identity concealment. So the idea that I have to hide part of who I am, whether I agree with it or not, if I think I'm not safe. So I'm going to conceal my, my lisp, or I'm going to conceal my gender identity, right? Higher rates of concealment tend to also be associated with poor outcomes. Gender nonconformity, right? So the more that individuals don't conform with a gender, regardless of whether they're trans or not, tend to face poor outcomes, right? Protective factor, right? This is one of the ones that might be both. Family acceptance, right? So family can be really harmful when they reject you, but the research actually indicates it is so important when they accept you, right? That can help mitigate a large number of the deleterious effects that we see, right? A lot of us in here, though not all of us, marriage, family, child counseling individuals, we know the importance of family, right? It's the first system we want to look at. It's the system that we operate in, right? So I want to underscore that, right? Individuals rejecting members of their family can be so harmful, but the positive side is when you can build that acceptance, that can be so meaningful, right? Social connectedness through things like, here's the next one, community engagement, right? So having friends, right? Having community, right? Social supports, we know this, right? Would you be shocked to know that they help protect some of these individuals, right? The unfortunate thing is that's my list. You can notice one side's a bit longer than other. That's more due to, there's not a lot of research on protective factors, right? There's a myriad of research looking at risk factors, but protective factor is kind of a new area people are exploring. I wanted to ask, again, the audience, how does this help us clinically? Or does it help us at all, right? There's also some chats I'm going to check on real quick. Hi, chats. Yes, intimate partner relationship. Oh, good one, Madeline. Yeah, definitely a person's relationship can definitely be a way to support someone if their partner's supportive, affirming. That can definitely be a huge protective factor. Thank you, Madeline. Anybody have an idea? How does this help us clinically? Yeah, that's a really wonderful point. If someone comes in and they're talking about this, I might know that's an area to kind of focus on, right? That might be something to kind of talk through with them, right? I love that, definitely. It gives us some direction and kind of also little things to look out for, right? I see a person coming in, they're struggling a lot. Have they talked about their family at all? Why not? Right? Might ask about that. What about your family? Or who's to say? We've all got family members that aren't great. We've all got family members that are wonderful, right? So definitely, I love that.
connecting to resources too, so if someone, doesn't have many protective factors, or they're not socially connected within the community, how do we point them to resources and things that would help them find connection?
Yes, Alex, I love that. And I know you on a personal level, like so good about how to connect people and increase access to resources. And that's absolutely something I want to highlight here, right? If I know that they're not connected to things, what are some of your interests, right? I wonder if you could find, some, oh, I like sports, but I don't usually play them because I'm gay. And just being with like other men, right? It's just not always a fun environment for me, or, whatnot. What about like an LGBT, like volleyball group, right? What about LGBTQ plus sports, right? Definitely. So trying to help encourage some of those things that they may want to do, but they're not doing, or finding areas like connectedness to try to help increase those. One of the ways that I use this model is I try to think about how can I sort of support, the word I was going to use is a very specific word, but support these protective factors, right? Like you said, social connectedness. How do we encourage that? Because we know feeling connected to others tends to help, right? Sounds a lot like with depression, right? Removing yourself, isolating yourself, less engagement in pleasurable activities. How can we increase that again? So I really love that suggestion, Alex. What's next? I don't remember. Man, I wrote this really late. Any questions before we move forward with this? Right. Want to do another physical and metaphorical temperature check. How are people feeling? Yeah, doing good. Feel free to step out. I got a green. I got some head nods and some greens. Thank you guys. If you need to step out just to cool off, please do so for yourself because it is hot in here, honey. I also did want to ask, this next portion, we're going to look at themes. What are some common themes that come up in counseling? And then we'll touch on vignettes, right? Anybody want to take a guess or some stabs at some themes they might expect to come up? Yeah. Yeah, definitely. Faith and religion would come up for sure. And in some ways that might surprise you too, actually. Yeah. Any other, yeah. Family expectations, certainly family would come up, yeah, or could come up, right? Certainly. Anyone else? Yeah, don't be shy. Yeah. Yeah. I've been a little under the weather lately, or I'm just feeling really keyed up, like something bad's gonna happen at any point, right? Certainly we might see that come up. Yeah. Any other suggestions? I love these. And I don't know that I had any of them on here, so that's why I love them so much. Yeah. Any suggestions from the chat? I don't see any, but please throw them in there if you want to. I love checking this chat. I love seeing that you guys are engaging. No, because I'm not getting paid. I can't monetize this. So I use very careful language of like, oh, certainly things that may come up, right? You saw me change that there. I don't want to tell you these will come up. Search for these, ask about these, right? These may come up. These are things that just from my, work in the community I've seen come up, or with the limited number of patients I've had, that I've noticed come up quite a bit, right? One of them is identity, right? People might come to you to explore or consolidate aspects of their identity, right? Exploring, we talked earlier about questioning, which I think is on here somewhere, right? Questioning. I don't know what my identity is. I've kind of been thinking about it lately, right? This idea, it's a bit antiquated now, but of coming out, right? You might have individuals come in to your session, or that you see in your practice or as a nurse practitioner, or who are on your caseload as a social worker, where I don't really know, right? So part of that might be helping them explore that. I'm not so cruel to make you go through another model. I just wanted to highlight there's this Bassinger's model of gay and lesbian identity development. If you've ever taken like a multicultural class or workshop, right? It's kind of parallel or similar to like the white identity development and Black identity development, right? Some stages individuals might go through. So if you think that might be helpful for you, especially if you have a patient that is exploring their identity, you might want to go look at that, right? I looked it up. Wikipedia is so cool, right? So look at your own leisure, right? But I say consolidation of identity because you might have individuals that come in like, I'm gay as shit. And I know that. That's, I'm resounding that fact. But they might be consolidating. What does that mean to me to be gay? What does that mean to be trans, right? How does that intersect with other aspects of my identity, right? So now I'm integrating that into who I am, my sense of self, right? So I know I'm trans, but what does that mean to me as a Black woman, right? Or I know I'm gender nonconforming, but what does that mean to me as someone who doesn't have access to a lot of money, right? That might be things that you're helping your clients through. Self-realization, of course, we want to encourage them to explore that, encourage them to take that on, right? Certainly we can help encourage that exploration. And if we might know some terms that could fit, we can help them with that, right? Oh, you say that you're attracted to women. I wonder, I don't want to assume, but do you think you might be gay or you might be a lesbian, right? If they respond to that, great. If like, no, I don't think that. Okay. Yeah, definitely. I hear that doesn't really align with you. What do you think? Right? Or in what ways are you not? Right? Let's explore that nuance a little bit. So let them realize it. Let them come to that, right, on their own terms. There's some clinical judgment in that for sure. So do your best. And I just highlight again, my goodness, pathologization of LGBTQ identities. That's definitely going to come up, right? I think I might be this, but in my family, they don't really fuck with that gay shit, right? I think I might be trans, right? But I don't know how to start transitioning in my workplace where they've known me as this person for 5 years, right? So something to be aware of. Okay. Shame is another big one that I see, right? And there's a lot of reasons for this. I want to share this quote by Brene Brown. If you don't know Brene Brown, she does a really lot of wonderful qualitative work in which she tries to really distill what shame means and its relationship to mental health, right? So she includes this quote, she defines shame as the intensely painful feeling or experience of believing that we are flawed and therefore unworthy of love and belonging, unworthy of connection, right? You will have individuals come in that believe they are unworthy of love or belonging and connection, right? Certainly that's something in a clinical sense we can help our patients through, right? If it's not our position to help them through it, it's something to be aware of, right? This person is coming in for treatment for something, right? And why are they alone? Why did they not bring somebody with them, right? It's this idea that there's something wrong with me and we may need to help our patient work through some of those feelings. There's this idea of rejection sensitivity, right? Some individuals being hypersensitive or hypervigilant of rejection. They may interpret benign cues as, oh, that's the person rejecting me. Or even like small little things as that they don't want me here, right? Wouldn't you guess higher rates of rejection sensitivity tend to be related to higher rates of poor mental health outcomes, right? So that might be something that you work through with your patient. Things like overt discrimination, right? That'll certainly cause shame, right? I was attacked for walking around holding my boyfriend's hand. And so what does that tell me? It's not safe to do so. There's something wrong with this. Macro level influences, right? What do we see in media, right? What does queer representation look like, right? Do we see queer politicians that look like me or that represent the things that I want? Are there policies or laws in place that are telling me this is something to be shameful of, right? Although individuals we may not be able to change those instantaneously, right? We can still help our patient work through some of those macro level influences. And I believe, I'm so sorry, my dear, I forgot your name, but you mentioned religious and faith-based shame, right? Religion or faith coming up. There's a history of religion and different faith practices being weaponized against individuals in our community. And I want to be clear specifically that I don't think I don't say any, a lot of faith and religions and forms of spirituality are not inherently evil. It's the way people use them or weaponize them against individuals, right? And I told you that might come up in more ways than you would expect. A lot of individuals in our community have their own faith, have their own spiritual practices, have a complicated relationship towards those, right? I was working with a gay couple actually last semester, right? And they came in and both of them, when I asked them to tell me about themselves, they both identified their faith. They were raised in the church. They sang in the church choir, right? It's a huge part of their identity development. One's church was more or less lukewarm accepting, the other one who weren't, right? He didn't go to that church anymore, right? That's a social group. That's a part of your identity that is now feeling like that part is rejecting you. I'd be shocked if that didn't come up, right? Certainly not the case for everyone, but I imagine it's the case for quite a few people. Another theme that's gonna come up, right? Safety and violence, right? There was this quote by Laverne Cox that I really liked. I actually wanted to use a much more morbid quote for this. I could not find it. Google did not like me trying to find it. So I instead went with this one, right? Who you are authentically is all right. The shame is what kills you. Believing you are unworthy of love and belonging, that who you are authentically is a sin or is wrong, is deadly, right? Charlotte's not here, but she mentioned earlier suicide and self-harm, right? The quote I wanted to find is, I don't know where I heard it, but someone had said, like, no one's better at killing us than we are, right? Whew, we're gonna breathe for a second, because again, that always just, I'm very protective of my community. And so thinking through some of these things, right? I want you guys to be aware of, if you hear people talking about things of like, oh gosh, I just want it all to stop. I'm just feeling so overwhelmed, right? Be sensitive to those things. It's with all your patients, but especially with this community, right? Dr. Greaves not here today. She did her training on suicide. She said, I want you to talk about it as naturally as if you're talking about the weather. Just ask. It might be there, it might not. Don't assume it's there, but I think it's okay to ask, right? I have that statistic I shared with you guys. We may need a safety plan, connect to resources like Alex said, right? Or if it's like a kiddo, right? We might need to make a report, right? If kiddo's saying that they're wanting to kill themselves, we might need to break confidentiality, right? Or if a kiddo is experiencing violence at school and it seems like no one's intervening, right? School, this is the 5th time I've been beat up this year and the school hasn't done anything. My parents haven't been able to do anything, right? That might be neglect. We might need to call and make a CPS report about that and not be so scared about it, but that might be what we need to do to connect kiddo to those resources, right? So not just their own safety, but harassment, discrimination, assault, and bullying. Bullying both online and in person, right? This world has changed so much, right? People feel so removed from people across the screen. They say anything, right? So that would probably come up, I would imagine, if you have someone on an online form telling you to kill yourself. Maybe I just should, right? Or if nothing else, I just feel really crummy about myself. And again, I just want to highlight again that fear or perception of violence. The threat or the perception is there, whether or not the violence is there or not, right? So I got beat up once at school and that person got expelled, right? They're not, they in theory can't do it again, but that perception of violence is still there. And so that fear is still there. That fear, that perception, that's what's going to have an impact on the mental health, right? Very similar to trauma. After trauma occurs, the individual may be safe or in a space of safety. They don't know it, they don't feel it, right? This is another one that's kind of similar to shame, but I wanted to highlight it as its own separate thing. This loss of agency, right? What does agency mean? I love dictionary.com. The capacity to act or exert power, right? I often think of it as like, if a person has agency, they know that they can affect change in themselves, in the world, in their environment, right? I can act and do something, right? You believe in a community that has been so disempowered and disenfranchised over history, some individuals may not feel they have that agency, right? A lot of our individuals will come in, apologies, and they will say things like, why try? I can't do anything. It's not going to make a difference, right? That is in itself a barrier, right? I'm not going to try to seek out resources if I think they're not going to matter. I'm not going to try to make friends or date if I think that there's no one out there for me or people won't accept me, right? Again, there's a long history of silence and hiding, this idea of being in the closet, right? This is something to hide. This is bad, right? If I think that it's something that I'm supposed to hide, I may be less willing to talk about it. And if I'm receiving discrimination, I may be less likely to do something about it. But I've been told to be silent my whole life, not to speak up. I've been told that it's my fault, not something that I can do anything about, right? And then self-esteem, of course, self-esteem is going to come up, right? Well, how do I think of myself? What is my self-worth? Um. Last one, fifth theme I wanted, dating, love, and community, right? Harvey Milk, don't we love him? If you're not personally free to be yourself, and that most important of all human activities, the expression of love, then life itself loses meaning, right? So for a community that was told you can't love who you love, you know, that might come up for them. I do want to talk about a peer who I consulted on a case with, right? They had an individual come in and the guy was lamenting about how I can't find people to date. I don't know where they like, where do you meet them except at bars or at clubs? And that's not my scene. I don't know how to meet people, right? There's this idea of, am I worthy of love? Am I someone that deserves to be loved or can receive love from someone else, right? Also, this idea of my availability is limited. Where do I meet people, right? I'm a numbers guy. They estimate about 4% of the population is gay, right? To put that in perspective, if I'm a straight man, I enter a room with 25 women. In theory, 24 of those women are in my eligible pool, right? One's not. Good for her, I'm not happy. But any of those 24 women could be a potential match. Certainly, they're not all going to be. Personalities clash, different values, different levels of attraction, right? So I'm not going to date all 24, but I've got some pretty good odds, right? If I'm a gay man, I enter in with 25 other men. One of those men is in my dating pool, right? Let's up the numbers. If there's 100 men, 4 of those men are in my dating pool. The other 96 are going to go off and be happy somewhere else without me. That's fine. I'm not bitter. No, but right. That doesn't say anything about level of attraction. That doesn't say anything about personality or values, right? So when you get numbers like that, it can feel difficult. It can feel disheartening, right? It can feel like, oh God, there's just, where do I meet people, right? So that's something that I think comes up for people. Anything left on this page? Finding community. So dating and love is great, but also how do I meet other people? You would be shocked at the number of people that I know who are LGBT identified that said, I don't really have a lot of gay friends, or I don't have a lot of other trans friends, right? I don't know where I go meet those people, right? I'm not trying to sleep with them or be in a relationship with them. I just like other people who are gay. I'd like other people who are queer, trans in some way, who maybe just get this experience in a different way, right? To bring it back to that person who I said I peer consulted with, right? I think for them, I said the best thing you probably can do is just validate that experience. You know, you don't need to go and find them partner for them, right? You don't go like, I know a friend, or why don't you try this app? Or why don't you go here, right? We don't need to solve the problem for them. We just need to help validate the problem, right? You may be the first person doing so. Yeah, I imagine it is probably really hard to meet people, right? Especially you can't always just tell. I can't be like, ha, you're one, right? And then I'm wrong and I look silly. So again, what we can do in those cases is validate that person's experience. We don't need to solve the problem for them, right? There's one little thing I wanted to mention. It's all the way back here. I'm so sorry. I just remembered when we talked about identity, right? Someone, I'm not gonna say who, and I were talking about this idea of one thing that is unique about the LGBTQ community and that as an identity is that we don't always have models of identity to look up to, right? For most of us, our parents are straight, right? And cisgender. So we talked about the difference versus like a racial ethnic minority individual, right? They have sometimes in their parents models of how to be a Black person or a Hispanic person. Like what does being Mexican mean? Well, I might look to my family of what that identity means, what those cultural practices are. And when I come into face-to-face with experiences of discrimination or harassment or people being ignorant, right? Oftentimes I can turn back to my family and they can kind of help me understand that, help me process that in a way, make meaning of it, right? Queer people, we don't always have that because our families typically, not always, because different configurations, but a lot of us don't have those models within our family. Even our families that are really supportive might not be able to help us understand what it means to be gay. I don't know, honey, but I support you, whatever that does mean. That's not to undermine that importance. That support is still pivotal in that person's development and upbringing, but it might just mean, where do I then go to develop that identity? That might be something they come to you for in therapy, right? I don't know any other models of what it means to be a gay man, except maybe what I see on screen, right? And only in the last 10 to 20 years has that started to diversify, right? Some of those models may not be the best either. So I just wanted to, I remember that one come back. Yes, please, please.
I have a question.
Yeah.
Facilitate the talk between, family that reject that, right?
Oh God, that's a hard one.
That's toughest.
That is the toughest. Yeah, I have some vignettes, and that's going to be our next portion. I have one that isn't exactly a family, but it's kind of a family. And one of the things would be, do we treat it as a family or not? Because there's some indications that dad's maybe not accepting. And so there's a level of clinical judgment there, right? You know, do I engage the family or not? Does the patient want to engage the family? Sometimes with children, like things like consent and what we might have to disclose can be an ethical decision we need to make, but does the patient want that, right? So that would be, to me, first and foremost. Does the patient want to engage family? Do they want to open up that relationship? Do they want to disclose that? If they do, and then you're at a point where you're trying to support them through that, or the family's there and they know and they're just not supportive, you can't make anybody do anything. We all have to sit with that fact, and it really sucks. I can't make this person be the dad that you need. I can't make this person be the mother that she should have been, right? But you can use your own personality, your own relationship with that family member, whatever, you know, in your practice, specifically as a nurse practitioner. I don't know the degree to which you're getting to know the family members, right? Sometimes we can leverage that. Like, I know you don't support some of what your kid's doing. It sounds like they really need you here right now, right? They're going to be going through a major surgery, or they're dealing with this illness, right? I wonder if you can put that aside for a moment and just be there and not worry about the identity. Because if the person doesn't make it, depending on the level of severity, that identity is not going to matter now, is it? Right?
Are there resources for families?
Yeah, resources for the family themselves, or resources for, so for families themselves. I mean, one that I know is called PFLAG, Parents and Families of Lesbian and Gay people. That's a really good one. Typically, people usually seek out PFLAG when they want to know more. So again, there has to be, I think, some level of the parent wanting to do a little bit better. If you have a parent they're just closed off, there's not a lot you're going to do that's going to change that. You know, you can try to have those conversations and encourage that. Other resources, PFLAG is the first one that came to mind because they did a self-defense workshop last year that I went to, and they were really cool. I mean, there's a lot of other cool organizations out there. Like there's like every Pride Parade, there's this group of mothers that always goes out and offers free hugs and stuff, right? To individuals in the Pride Parade. If you have someone who's like, I want to be more supportive, I don't know what that looks like, you can connect them to them. Those are the only two that come to my mind right now. There's certainly educational resources. Any LGBT resource center will have some kind of pamphlet or flyer on how you can be a supportive parent and stuff, right? So if you meet some individuals that are kind of like, I want to do better, there's some of that readiness, some of that motivation, those would be great resources to connect them to, right? Here's some things you can do right now.
I
Yeah.
know we kind of like psychoeducation groups for parents.
Yeah.
I know there's like mixed, yeah, like from what I've read, there's mixed thoughts on the role those groups play and if it should exist or not. But I don't know, it makes sense to listen.
Parenting groups for LGBTQ plus people. Yeah, absolutely. Those groups do exist. And I would want to look at, like, you know, is there a curriculum planned with that? What are the goals of the group and stuff like that, right? People are at different levels, right? So if it's a group that maybe the intention is, how do I come to acceptance with this, or even tolerance of this, then I might encourage that for someone like some of your family members, right? Versus someone who is already wants to, you know, they're all about it and they just want to learn how to be better about it. Those are different stages developmentally for parents, right? So I definitely would encourage some of those groups if someone's posting them, for sure, but just being mindful of, is the group going to maybe fit the parent, right? Some groups are gonna be all inclusive. Please get up and grab pizza. All right, pizza's here, it's yummy and warm. Go grab some pizza at any point in time. You have my permission. But yeah, that's a really good point, Alex. Yeah, groups, sometimes encouraging them to maybe talk with their own therapist, right? Oh, I wonder if you're in therapy, right? Especially as a nurse practitioner, you're not maybe gonna be doing that yourself, but you can definitely connect them to some of those resources, right? There's a therapy group here in Fresno called Safe and Affirmative Counseling. They do a lot of work with LGBTQ plus people and their families, right? So if you're kind of like, there's definitely some dysfunction here in this family, I wonder if you'd be open to going to like family therapy, right? I know this really great place that might be a good resource for you.
Is there a fee for therapy?
Yeah, they do take insurance. They're a private practice. So I don't know the specifics. I don't work there. I'd love to. If you hear me, Henry, yeah, putting that out there. But it is they have some sliding scales that I know about, but it's based on like clinician availability. And I think there's like a set number of people they can see on that scale. So you would just have to explore that with them. But if they have insurance, you know, obviously that always helps free some access up. So yeah, great question. Thank you for that question. All right, we got maybe about 10, 15 minutes left. I see some chats, some chatty poos. Someone has to head out. Thank you so much for coming in today, Madeline. We really appreciate that. And Zeta, a really great point. We might look to fiction or TV for those role models as well. Definitely. I think for a lot of LGBT people, that's where they learned how to be LGBT, right? So do you guys want to get into some vignettes? Blah, 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 blah. Does that sound good? Oh, I guess I had a takeaways point. Whoops. I was very tired last night. Some takeaways, right? I noted some specific themes that might come up, but certainly there's going to be more overlap than differences, right? A lot of people who are LGBT are going to come to you because they're having problems in their relationships or because they're afraid of being rejected. Well, a lot of straight and cis people are afraid of being rejected for different reasons, right? A lot of them are going to come to you for things like trauma, right? The source of that trauma may be unique, but how you work through that process, that may not be, right? So I wanted to highlight that. Don't look for issues where they don't exist, right? And so kind of like you mentioned with the faith thing, right? If someone comes in and they start mentioning their faith, oh, that must be really hard for you because I know that church isn't accepting. No, my church is actually great. I have a very strong sense of faith, right? Not that you assume that. I'm just saying. Same thing, right? Don't have someone come in, oh, you know, I identify as gay. Oh, yeah, like, have you come out yet? Like, what does that look like for you? Like, are you accepting of that yet? Like, girl, I've been out for 20 years. Like, you know, like, so let's not assume things. And let's not look for issues where they don't exist. Your therapeutic relationship, we know, is so key, right? Even for you as a nurse practitioner, is going to be key. How can I leverage that relationship with them? Do I have rapport with the person, right? Where they're going to trust me? Your presence, being present in session, and also your genuineness, right? I think genuineness gets forgotten a lot, but if you show up as your genuine and authentic self, that models and encourages the patient. You can do the same. And I'm willing to hear you and see you as your true and authentic self, right? Now, if we have values that maybe don't align with this community, I wouldn't necessarily share those, right? I might keep those. Yeah, keep those here. You can still have your values. I'm not here to police anybody. But you don't need to be like, oh, yeah, you know, yeah, I'm not really for that stuff, but I'm glad that you're out. Yeah, so genuineness, but that little caveat of let's keep our personal beliefs and values to ourselves, right? Different theories can work. You notice I didn't highlight like, girl, you go client-centered, or girl, CBT is the way, right? I think any theory or approach or model can work with this community, right? I'm actually interested to hear some of that you guys might think are implicated, so I'll ask that in the vignette, but I didn't name a specific theory or theories for a reason. And just to emphasize, the identity itself is not the problem, right? Someone comes in and says that they're asexual. That might look like some of the disorders that we know in the DSM, but it might not be a disorder because maybe it's not causing any impairment. Maybe they don't have any distress about that, right? So the identity itself, that's not the problem. It's usually people's reactions to, or the environment, or the lack of support, right? Those are the things that we can target and work on, and that we should. Anything else to say? Nope. All right, I have four. We don't gotta get through all four. Who feels ready, empowered? Again, metaphorical and physical temperature check. Where are you guys? You're feeling good? I see greens, I see smiles, I see pizzas being held up. Okay, okay. So there's three questions that I'm gonna propose to you. Do with them what you will. You can answer one, you can answer none, you can answer two, three, whatever you want to answer right now. When reading through these vignettes, what is something you would want to know more about with this vignette? Are there any ethical considerations? Or what is a potential direction, theory, approach, or intervention you might want to use? What are some themes that you notice? Or what is something you'd be nervous, scared, or apprehensive about with this vignette? Does anything require immediate attention? Right, so what we'll do is I'll ask if someone wants to read the vignette. Once we read through it, I'll go back to the questions just so you have them up, okay? Does anybody feel empowered to read today? If not, I'm happy to do it, but if you feel empowered and would like to read, you can.
I'll read one.
Do you want to read one? Okay, awesome.
Imelda is a 22-year-old Latinx bisexual woman, pronouns she, her, and they, them. She came in seeking treatment for anxiety and depressive symptoms. She shared she has an overall fear of rejection by others that makes her feel isolated at college and makes it difficult to maintain relationships. Imelda reported a recent incident where there was a verbal argument between a close friend stating, "My world felt like it was falling apart." Imelda also reported she is a trans woman and she recently began gender affirming care a year ago and transitioned living full-time as a woman over the last 2 years. She shared she's been ruminating on her body image and has had significant chest diaspora that contributes to low self-worth, and she's quite aware of facial hair. Imelda reported feeling depressed 2 to 3 times a week and having thoughts of self-harm in the past 2 years. It also explained having a thought, not seeing friends as much and feeling guilty for making mistakes. She shared that her grades were taking decline.
Perfect. Thank you for reading that. You guys on Zoom, if you want to throw some of your ideas in the chat, please do, and I'll read them out loud. I'm going to go back to the questions so you have them up. If you need me to go back to the vignette to look at something, let me know, okay? These are some of the questions I want you guys to consider, right? Come on now, don't be shy. Harsh.
Well, we're kind of number 1 and 3. I want to assess for any suicidality,
Mm-hmm.
you know? Especially with the depressed mood, and what seems to be like some sort of social isolation and the lack of, you know, friendships or closeness. So I definitely want to assess for that. I want to know if there is any sort of suicidal ideation or even a past history of it.
It's a wonderful one. I'm glad you brought that up, definitely. Right. Any other thoughts? Yeah, Maddie. Absolutely. Yeah. Would it surprise you to know this is based on, inspired by things have been changed and redacted for confidentiality. This is based on a real case. Yeah.
Like what kind of internalized. You know, transformation.
Yeah, it's a good one, right?
That's, that's causing her so much distress about her mission back.
Yeah, definitely, right? What are her beliefs and values, right? What does she internalize? Good one, Charlotte. Harsh, yeah, go ahead.
I feel like perhaps CBT would be a pretty good approach, you know? I mean, we know it's good when it comes to treating depression and anxiety.
Yeah,
But I'm also just thinking about her feeling guilty and having all of these like, you know, cognitive distortions almost. Because when she says feeling guilty, I wonder how much of it is actual guilt or actually shame.
yeah. I'm glad you brought that up, because a lot of times when I work with people clinically, when I hear someone repeating the word guilt a lot, that's a question that I'll kind of ask. And sometimes I'll even ask it verbally, like, you said guilt about 3 times today. You feel guilty about this. I'll do a little psycho ed about guilt and shame, and then I'll ask, do you think that it's really more shame that you're feeling, right? Versus guilt? Because let's not expect all our patients to use the language we use. So guilt sometimes is shame in disguise, right? And I mean, I'm a CBT girly, people that know me know this, hashtag, right? But it can be effective for things like if I have internalized beliefs, how do I start to challenge that or reframe that, right? How do I look at that differently to where it's not affecting me or causing me distress, right? Certainly. Yeah, Maddie.
You mentioned earlier, like strength-based, approach, and I think it would like focusing on strengths and stuff like that. We have a conversation with, for the past 2 years, like what are the positive qualities she's likes about herself and feels comfortable and excited about the past 2 years.
Yeah.
Because I see that low self-esteem, self-worth, and maybe exploring like what is it that's been helping these past 2 years.
Yeah, absolutely.
Kind of build up that
I love that, Maddie. I'm also a big strengths-based girl, for sure, right? What internal resources does this person already have, right? You started transitioning. It sounds like that took a lot of confidence, right? That confidence is a huge strength of yours. So I love that strength-based approach. I think especially for this community, that could be really impactful for people that have been depowered, right? So I love that. And then I know Zeta in the chat, you mentioned, right, risk assessment would be important. Absolutely. Whenever we see depressive symptoms, we want to look at risk, right? It's one of the symptoms of major depressive disorder, thoughts of death or suicide, right? So definitely, Zeta, I'm glad that you highlighted that. Risk assessment would be important here. I can't tell you what you should do, right? A lot of these, it's my first time seeing, so some things that I thought was interesting, right? I want to know, what supports does she have? She doesn't mention anything about her family, or she mentioned, right, I'd want to build up some of those supports. She mentions one friend, but she's having difficulty maintaining relationships. So who do you have in your life? What role is your family playing, right? I think earlier you might have mentioned something about like family coming up in session. Something I try to ask, right, if your family's not supportive, is there one member, right? Is there an aunt or uncle, right, that's like just stupid liberal and like, maybe you've always had a good rapport with? Is there a brother or sister that you grew up with who maybe can be a support for you, right? Some level of family support is better than nothing, right? So maybe mom and dad aren't the most supportive, but maybe there's another caregiver or another family member that you can kind of leverage. So I'd want to know that. One thing that came up for me when I was reading this, I don't know why, the first thing I had, I kind of thought empty chair, right? Is that implicated or not? I don't know. But one of the things I thought is, can you speak to those parts of yourself that you are feeling dysphoric towards, right? Can you speak to that part of yourself that you no longer identify with, right? So that was something, right? Empty chair is not always indicated. Some people really don't like it, but that came to my head. Client center is always great. I also thought CBT would be here for the guilt and the rejection, right? And then you guys wonderful, you said it, self-harm and safety planning, that'd be an immediate concern for me. Is she safe, right? Is she having those thoughts? If so, what does that safety planning look like? Other worries, just in general for me, right? I'd want to just make sure, like, I'd be worried about using pronouns, using the right pronouns, like, right? I'd be hyper vigilant about that, making sure I'm reminding myself a session, right? Talking about the source of the dysphoria, that might be kind of hard for me. You mentioned chest dysphoria. I'd be like, I know I gotta broach it. I know I gotta ask about it. How would I ask that, right? That's okay. Those are some ideas you can work through with supervisors, right? So I want to be respectful. Our time is about 1 o'clock. If people want to keep going, we can, but I also see people packing up. No, don't be sorry. I'm so happy that I made 2 hours because I was like, I knew that there's a lot to cover. So, thank you. Any questions about any? This is what I'll do. I'll give everyone a few seconds. If you guys want to exit stage right, feel free to do so. I can hang out for a little bit longer. We can go through some more vignettes if people want. Do not feel like you have to. Those of you in the chat, that applies to you as well. If y'all got a skedaddle, thank you so much for coming today. I had such a joy talking to you all. And yeah, thank you too so much for coming, guys. I appreciate all of you.
Yeah.
This is the encore. Yeah.
Encore.
No, don't be sorry. I'm not one. Girl, your time is important. You get out of here and have good boundaries. Okay, yes. Some people in the chat said, thank you so much. You're welcome, Zeta. Thank you for coming today. We will send you out a copy of this once it's recorded. And I'm also going to include a copy of the PowerPoint for people, right? You're welcome, Rosa. Thank you for coming on by. Paisley, you can have some pizza if you want to come get it, girl. All right. So I'm going to go ahead and continue with the next. We only have 3 more vignettes. We can speed through them. We can take our time, whatever you guys want. Oh, more chats. Oh my God, you guys. And I spoke on this, but something that always comes up that I am super mindful about is having to use a dead name when asking them to fill out forms if they have not made the legal name changes, right? Professor Bloom, thank you so much for bringing that up. That is a big part of dysphoria for trans and gender non-conforming people. If they've changed their name, right? But on legal documentation, right? That we might have to have them fill out forms. We might need your legal name, especially if in the future we're someone that's charging insurance, right? That might be a name that they've changed in their everyday that has not been legally changed. And unfortunately, sometimes we might need those forms to have that legal name on it, right? It's not a fix-all or a cure-all for sure. One thing that can help with that is having a preferred name, right? Another thing that can help with that is being genuine, right? I have to ask for your legal name on this because I'm either billing insurance or for other record-keeping purposes, right? But I want you to know that I will always respect your preferred name, your preferred use of pronouns, and that is what I will default to, right? So being genuine about that, why I'm having to ask for it. If these people are like, using insurance and they want to get help, they'll probably put the name here. I don't think they'll be like, no. But then we can also talk through that in therapy then, right? Once we do start services, right? What was that like for you? I always hate having to ask that for my trans and gender non-conforming people. I just want to check in and see how you're doing right when we get started, right? So Professor Bloom, thank you for bringing that up. I'm so happy that you highlighted that. Also, Professor Bloom, I don't know if anyone else, but I think you're the only professor that came today, so you get brownie points. Show support, I appreciate it. Do you guys feel ready to go to the next one? Ooh. Oh, hold on, there's another chat. I'm not ignoring chats. Yeah. Thank you, Bloom. All right, vignette number 2. Does someone else want to try reading this? Arsh, you want to go for it? Are you gonna do voices? No, just
Enrique, adult male, 32, presented to therapy with his wife Fernanda, adult female, 33. Due to marital conflict after agreeing to an open relationship, Enrique shared he was uncomfortable with the idea of seeing other individuals, but reluctantly agreed. The couple reported they established some rules in order for the relationship to work for them, such as an agreement that they don't spend the night at the partner's house. Fernanda eventually began seeing someone outside of their marriage, and after a few dates, she spent the night with her other partner. Enrique was upset and sought couples counseling in an attempt to figure out a way to make the relationship work. Enrique had not had another partner, but allowed his wife to do so, even though he was not happy about the direction their marriage was going. After some time with a previous therapist, the couple reached a compromise, and Enrique began to be more comfortable with the idea of another partner. Eventually, Enrique also began to see another partner. Conflict in the relationship emerged again when Fernanda shared she was now uncomfortable with the idea that her husband was with another person. The couple requested a female therapist or a male that was a member of the LGBTQ plus community.
Great job, Arsh. Thank you for reading. Yeah. So many thoughts. And if anybody wants, I can go back to the questions as well. Just let me know. Mr. Arch, did you have something you wanted to share?
Yeah, I'm curious as to what exactly Fernanda feels uncomfortable about. So I'd like to explore exactly what that is.
Yeah.
You know, where that's coming from. Because I feel like once I'm able to understand exactly where that uncomfortability is coming from, I'd be able to kind of determine like the approach that I'd want to take or how to go about like working on the direction.
Yeah. Yeah, I really love that empathy, right? You know, that uncomfortability is coming from somewhere, you know, where I want to understand, right? Taking that time to, you know, what can I help Fernanda work through in this relationship, right? I love that.
I can see myself having a tough time knowing what to do or say.
Yeah.
I've only, been in monogamous relationships.
Yeah,
Just being able to relate.
definitely. Yeah. What parts do you think would kind of would you struggle with?
Maybe just having my own, opinions or thoughts about what could work for them, but like not being able to,
Yeah.
obviously that's not my place to assert my opinion.
Yeah. Absolutely. May I ask you a further question?
Sure.
What is something that you could do to kind of help with that, right? Because I get it. Most of us might have heard of polyamory, but might not have all engaged in polyamory. And so
I think I would definitely need to like talk to more people in that community, or even just like watch videos on YouTube of whole experience, or
yeah. I love that idea of doing your own research. I love that, right? Definitely, right. And it is true, right? We're not supposed to put our values on other people, right? So I appreciate you bringing that up, because one thing I want to encourage, right? It's not necessarily the fact that they're in a non-monogamous relationship that's the problem. Certainly that can work for some people, but it's not working for them. And I want to understand, like, what is the level of, like, why are you uncomfortable with that, right? Or what about this isn't working for you, right? And in that way, we're not pathologizing the polyamory or the open relationship or the relationship configuration, right? What other things can we look at that we see are issues for this couple, right? Yeah.
It's important to explore, the foundation.
Absolutely.
Why the relationship, or why did Enrique allow it and then now it's reversed?
Yeah,
You
right.
know? But the other thing that I question is, why is it that they're only requesting for, therapists or that kind of thing?
Yeah, I love that you caught that. I threw that in there, right? And have a great day, Carrie. Again, inspired by a real case. Lots has been changed, right? But that was one they did request that. They did. And that's interesting, right? Why might they request that? Yeah. I can't give you the answer. I didn't see this patient, right? I might think something like maybe a woman or an LGBTQ plus therapist would understand more, right? I know in kind of a different vein, but like I know of a lot of Black people who are like, I want to see a Black therapist, because there's some element of that they're going to get that a non-Black therapist wouldn't get, right? Now, I firmly believe that we're all able to help. I cannot only work with white LGBT people. Now, I'm gonna be out of client base. So we can all support people of different walks of life, right? They also have a right to decide who they want to see, right? Might affect when they get seen, but they can do that. But typically when I hear stuff like that, the first thing I think of is comfortability or safety, right? I feel safer or more comfortable with an LGBT therapist or a woman, right? We also don't see here who's requesting services. Oh wait, actually I think it did. Enrique presented with his wife. And then it says Enrique was upset and sought couples counsel, right? So Enrique is requesting that. It's interesting, right? Yeah. Great things. Any other things? Ethical concerns, immediate attention concerns, crises, theories or ideas what you'd want to use, things you'd want to know more about.
I think that was, I see if there is that type of conflict even before
night, so what about spending the night? What's going on with him
Yeah,
in this kind
yeah. I love that you brought that up, right? That's a rule or a boundary in the relationship. And why, it might help us to understand, Enrique, why was that important for you? And then also, Fernanda, we agreed to this rule in our relationship, and this boundary, and you crossed that, right? It's kind of like being unfaithful. What's the number one rule in a monogamous relationship? It's just you and I, girl. So when someone steps outside of that, they're crossing that person's boundary, this agreement that we came to that we'd only see each other, and now you're seeing someone else. This is a polyamorous relationship, but we can still apply a similar thing of, we agreed we wouldn't stay the night at someone else's house, and after 2-3 dates, you did that. So I'm curious, right? Where does the rule come from? But then also, why did we maybe not respect that rule, right? There's some chatty poos in here. There are some really great trainings at Affirmative Couch for LGBTQ plus communities, such as in other words, mono-poly relationships, intersectionality of bisexuality and polyamory, structuralist family therapy with polyamorous individuals. Oh, I love that, Jessica. Thank you so much. There's a link in here, you guys, that I'll be sure to send out when we send out the information for the PowerPoint, right? But yeah. Anybody want to propose anything else? I can read a few things I have on here, or we can go to the next one. Thank you for that, Professor Bloom. A few things that came up for me when reading this. Again, we mentioned boundaries and rules, right? What are other boundaries and rules in this, right? It's important to understand that in any relationship, including a polyamorous one. Why did they open the relationship? You mentioned before. Were they happier before? Were these conflicts coming up before? It's a really good question. I believe I think it was you who had asked, right? Why did they decide to open it? Seems like Enrique was reluctant, but then they did open it, but now it seems Fernanda struggles with it. So I'd be curious, I just asked, why did we open it? Not in a judgmental way. I'm just curious, right? It seems like you didn't maybe really want to, but you did, and now you're on board. What does open mean to them? I'd also want, what is their level of trust? I'd assess their level of trust and their level of commitment. I think that you mentioned earlier, right? How committed are they to each other? How long have they been together? That's not indicated here, right? I'd want to work on things like communication, trust, accountability, respect, potential approaches or theories. I mean, I see a lot of attachment in this. I would definitely think of like an attachment lens or EFT for couples, right? I even think like Gottman's like repair attempts might be helpful here. It seems like some things have been kind of transgressed. So what are some repair attempts that we can make? And then I might assess for conflict styles. I would want to keep an eye out for any indications of IPV. Not that it would be there, but just in case, right? Just keep an eye out for some of those flags. And the last thing I said, very much similar to Charlotte, right? I'd be scared of not pathologizing the polyamory itself, right? Really doesn't seem like this is working for you guys, but I don't want you to think that I'm judging you for doing it, right? Maybe we just have to figure out a way to make it work, right? Maybe we just haven't figured out the right rules or boundaries, or maybe this is not a good relationship for you guys, right? Especially if Enrique reluctantly agreed to it, right? I always just hung up on that word. Sometimes individuals engage in relationships because they're scared of losing someone that's important to them. So maybe Fernanda is polyamorous and maybe Enrique isn't, right? That's okay. That doesn't make you a bad person. Let's not assume that, but I would want to explore that. And I'd be scared of pathologizing that, right? So kind of similar to your fear, right? I wouldn't want you to feel like I'm judging the polyamory. I'm just wondering if it's a good fit for you, right? How do we feel? Are we ready to close out? Keep going, trudge forward, up to you guys. Yes, sir.
So, how important is it for us to ask them if they wanted a female therapist or a male therapist or certain activities?
I would ask. Yeah, I would just, do you need to know, but you asked if it would help, it could, right? Explore with that. Hey, Fernando Enrique, like, it does say on the vignette that you wanted like a female therapist, an LGBTQ plus therapist, right? I am curious, where does that come from? Or like, what was your intention with that? I mean, you could ask it a number of ways, but it might be worth exploring that. And I would be interested to hear what they say. Yeah. I would want to know personally, but the question of if it's helpful, that's gonna be clinical judgment for you, Chewy. Yeah, good question though. Anything else? Keep
Yeah, I'd be
going?
interested to know like their past relationships or their past experiences.
Yeah.
Why she's wanting that and why he would have such a.
Yeah. Yeah, I definitely agree. And like I said, one thing that glared to me is like, how long have y'all been together? Right? Is this like, we are in this, we are like, this is forever for us, you know? That might be very different versus, we just started dating about 6 months ago, right? Neither one is more or less valid, but that just might affect certain things, right? That might affect, level of commitment, right? Like I'm not gonna end this. I'm gonna make this work somehow. It's just how to make it work. Versus maybe 6 months in, someone's like, if this isn't a good fit for us, it might be parting ways, right? Are there kids? It doesn't say in here if there's kids involved, right? Does that affect things? Does that make a difference, right? Great question, Charlotte. Yeah, Ash.
It's weird. I literally had I know people who've sort of been in this situation before, and I know that not all relationships are the same, obviously, but I'm wondering like with the person that I knew, he was in a polyamorous relationship with his partner, who was engaging in relationships with women, outside of that relationship with him. And then when he, the longest time, he wasn't seeing anyone else, because he was just in that relationship with her. And then, when he started to see other people, it seemed like she was protesting because it brought out the sense of insecurity in her. As she kind of just went into those other relationships knowing that he was always gonna be there and he was always gonna only be there with her and not reach out into other relationships. So I don't know, do you think it's I don't want to make assumption, but my mind immediately just goes to oh, this person for some reason has having insecurity issues, especially when they were the first to break the trust of the rules for the relationship. How would you even go about addressing that? Would you do it in the first session, or would you just
It's a really good question. And I want to say, right, in terms of how you go about addressing it, there's no one right way, right? Something that I would be interested is, like we talked about, what are the rules and boundaries in this relationship? Was it only polyamorous for Fernanda? It certainly doesn't seem like that. It seems like you both agreed to a polyamorous relationship. Like you said, it feels like what we might call, and we might hesitate to call it, but it feels like a double standard. She's allowed to go out and engage in additional relationships, but when he does, it's a problem.
Right.
Why is that, right? And I can't tell you why. We would want to explore that with them together, right? Fernanda, what is it about Enrique reaching out to someone else that seems to upset you? What emotion first is that? Are you jealous? Are you angry? Do you feel abandoned, right? Help identify that emotion. And then, so now where is that coming from? Right? Is it an attachment thing? Well, I've had partners leave me before. Okay, or it's just my own sense of security, right? I want to be his main person. When he starts seeing someone else, I feel like I'm no longer the priority, right? It could be any number of things. But I think you're catching on something, and that's kind of why I threw some fun, tricky ones in here for you guys like this, right? There's some things going on here that I think are making us maybe a little bit uncomfortable. Certainly some of that might be, I've never worked with a polyamorous couple for sure, but some of that might also be, feels like a double standard, right? It seems like maybe Enrique, he consented for sure, but maybe he didn't really want to be in this relationship. I think that we might shy away from asking those questions because we don't want to judge that it's a polyamorous relationship, but those are important questions to ask. That's why Charlotte asked you, what would you do with some of that? And if you, talk to the supervisor, they might help you work through some of that. There is the polyamory piece, but it does seem like maybe you're also noticing this bit of a double standard there. You can address that, and you want to make sure you word it right. Okay, let's practice wording it in here. How do you bring up this double standard in the relationship in a way that doesn't judge the polyamory itself, right? That's a good question. And that's something that you can do, because then answering and exploring that might lead us to, Fernanda, where is this discomfort coming from? Right? So yeah, I threw this in there to be a butt. Definitely did that on purpose. Again, inspired by real events. right? Do with that what you will. Any other questions, comments, motions, right? Anything else? Yeah, Chewy, go on ahead.
No, as far as theory, can you use, solution focus? And to figure out, what happened, what is it about the relationship that you want to fix?
Yeah, absolutely. Yeah, is that a theory that you like a lot, solution focused?
I'm starting to lean towards it.
Yeah, yeah, I like solution focused a lot, especially in cases where maybe there's not high crises or risk. Some people come to therapy and they just need to solve something, they need to work through something. And that's true for couples, right? We don't know, but let's say this couple's been together for 15 years, they're committed, they're in it to win it. Separation's not really an option. That's not something they're interested in. Okay, so it's gonna turn to how do we help solve this, right? And then if you guys say you want to continue to be polyamorous, okay, how do we configure this relationship in a way that you both are feeling respected, loved, and instills a sense of trust, right? We're still working on the same things as we do in monogamous relationships. We're still doing it the same way. We're just not judging the fact that there's other people that they're including in the relationship. So solution focus can be a great one, right? I mentioned Gottman on there before. Gottman could be really helpful with this, right? Is there resentment building up, right? Is there criticism in the relationship? We don't see communication or conflict patterns in this, right? Those would be important things I'd want to understand as well. Great question. And I asked if you like solution focus, because if you do, then I certainly think there's a way you can use it. Yeah, I don't want to limit theories here, right? I don't want to limit approaches here and be like, client-centered girl, you got to do better, step it up. No, client-centered is a great approach, right? Solution focus is a great approach. So if that works for you, I think it could work here for sure. How do people feel? We want to call it a wrap? We want to move on? What do you guys want? It's your workshop, and I enjoy this stuff, but I'm also happy to send out the PowerPoint if you guys want to go.
Yeah, let's do one more.
Okay.
Let's make it 3.
Okay, we'll stop at 3. Now I'll let you pick. You want to do Patrick, 26-year-old man coming to therapy for self-esteem, or do you want to do Eliana, a 13-year-old girl brought in by her parents? Both are queer, or not queer, but have queer themes in it, okay? Do you guys have a preference?
4.
4? 4, okay, because this is a little bit younger, right? We haven't worked with this yet. Does anyone want to read it? If not, I'm happy to read it. It's up to you.
Oh, you want to go ahead, yeah.
Eliana is a 13-year-old Latina girl who was brought into therapy by her parents because she's getting 4 grades in school. Eliana's parents indicate that she doesn't seem to eat much and is losing weight. She is tired all the time and is feeling really sad and worthless. Her mother is worried because she has been withdrawn lately, especially after an incident at middle school where Eliana's friend, Erin, was waving a rainbow flag during a rally and was assaulted by some other students. Eliana's friend is assigned female at birth, but now identifies as a man. Eliana has been friends with Erin since the 2nd grade. After a few minutes, Eliana's parents step out into the waiting room. Eliana shares that she has begun dating Erin. She says she's not sure what to tell her friends when they ask if she's straight or a lesbian. She thinks of Erin as a man, and so she thinks she's straight, but she knows Erin's still empty and female, and that doesn't bother her. She's just holding hands, having interest in Erin for now, and she isn't interested in going any further yet. She does tell you that if her parents knew she was dating Erin, they would feel bad for you. When her father is drunk, he says all kinds of bigoted things against LGBTQ people. However, she shares it only makes her want to react more.
So I will share that this was based on a comp vignette from a few years back, heavily redacted because man, they like to write long comps, right? So just FYI, this is something that came up in a comp exam for any of you girlies taking comp exams. Uncomfortable laughter. Any thoughts?
So definitely, explore the enjoyment.
So glad you went right for it. That'll serve you well in the comps, right? Right. So are we being hyperbolic or are we really concerned about safety? We want to explore that for sure.
Almost it's like maybe CPS when the father gets dropped out.
Okay, potentially, yeah, I want to know more about that. Based on just this, it, not, probably not. Now, there is what's called a permissive report. So, physical abuse and neglect, surely we are mandated report. When it comes to things like emotional abuse, it's a permissive report. You can report it. And so depending on the things that he's saying, or, you know what I mean? So I'd want to know more, but it could be for sure. It could be. Yeah, I like that your mind is going to like crisis, safety and stabilization, right? Something I want, never mind, I'll let you guys explore. Yeah.
I would see if that flip out trailer is also connected with her feelings of sadness and worthlessness. Just explore more, her family's views on it, making her sad, as well as, what happened at, school as well.
Absolutely, right? So for a lot of us, right, our patients present with symptoms. How are those symptoms connected to this larger tapestry of their life, right? Is the fact that her father is unsupportive, is that maybe impacting some of these depressive symptoms? Did what happened at school, is that having an impact as well, right? Definitely. I think that's right on the money.
I think curious if, her mom is supportive of LGBTQ, she did say that her dad, is more so bigoted, but I'd be curious to know her mom's views.
Yeah.
Sharing with her mom, that would be that.
I love that. So I'm gonna ask you and the rest of everyone a question, right? Do we think, what modality are we thinking about with this patient, right? Are we thinking individuals? Are we thinking family? Is that is there some reason maybe that might be contraindicated why we might not want to do family, right? What do you guys think?
I would probably start out individual, and if she feels comfortable enough with her own feelings and her own sexuality, ask her if she'd be open to bringing in the family, because they seem pretty willing to, like, bringing her in and like saying that they're concerned for her.
Yeah, yeah. And then you had your hand up as well.
Yeah, I agree. I think, I see that it's very common. And I think that's the hardest part which is why I was asking earlier, because that's like, when you find out information like that, like, how would you, I guess you can say you need to monitor the kids really close, but at the same time, they're going through so many mental health behind the scenes that you worry for them too. For example, like there's a lot of things are going through her mind and she's still, exploring. So at this point, I would say what I would do in that situation is probably more behavioral therapy in a way where she has an outlet where she can facilitate her, process her own thoughts. But what's important is to have the parents be aware later when she's ready.
Yeah.
If she's not ready, it's a lot uglier than it.
Yeah. I love both of you are really highlighting this client-centered undercurrent, right? Let Eliana say what level she wants to engage in, right? Certainly most patients will come in and they'll say a modality of treatment they want, right? So whether they present for individual or family, they'll tell you, right? You as a therapist may, may say like, oh, I wonder if why don't we start with individual first and then move, we can move into family eventually, right? So you can definitely, there's some ways that you can kind of advocate for your patient, right? At least in terms of treatment, right? I think you are both kind of hitting on, I don't know if family is indicated in this. And honestly, I think I agree with both of you. I would want to know more about dad and mom and levels of support and acceptance before I get them all in a room together, right? This is an ethical dilemma that comes up a lot when working with this community, especially with kids. So whoever chose for number 4, good on you. Because when we have kiddos and we have things like consent, and then parents want to be involved in the process and know about things, it's similar to working with kids in general. They still hold the confidentiality to stuff. But if parents are insisting on doing doing family therapy, right? Well, if you're not gonna do it, we'll go somewhere else. Okay, they might need to go somewhere else if you really think it's not indicated. And it can get more complicated than that, right? But I wanted to ask the question, right? If mom is supportive, maybe we just engage mom. Hey, actually, we thought, it might be able to have mom come in for like a few sessions, right? Again, that's gonna be based on what Eliana shares with us. I know mom would probably be an ally and stuff, but I just know dad wouldn't be. Or maybe dad says that shit when he's drunk, but usually when he doesn't drink, he's fine. I don't know if he really believes these things or if he's just drinking and just saying stupid shit, right? We just don't know. So I love both of your client-centered approaches because I think that that's definitely indicated here, right?
It looks like she's struggling with her own identity as well. To be contributing to, being withdrawn and,
Absolutely.
doesn't know what to tell her friends at school and.
Yeah, so in terms of our themes, right, identity would be a big one right here. I don't know if I'm straight or lesbian, and I don't know people to tell people ask me, but I like this person. I think of them as a man, but I don't mind that they have, quote unquote female genitalia. So, well, what does that mean to you, Eliana? Right? Yeah.
I'm just curious, this is the other side, I don't know. If I, like, just pretend, if I refer this kid to you guys, how would your approach be on the other side with this situation?
What do you mean? What do you mean by
Like,
approach?
How would you approach on a 13-year-old that, is coming to you for behavior? In this situation, that the parents don't know.
Yeah, I mean, so every clinician's have kind of a different approach, right? So if, you were kind of indicating, I think behaviorism might really be a helpful approach here, right? I'd want to make sure we try to connect with a clinician that really can do that justice, and many can. It's not hard. Many know how to, but there might be some people that are just like, that's not my method of treatment. I don't really do a lot of cognitive behavioral work. But one of the things that we do see here, right? Her father, she wants to respond with more pro-LGBT stuff. If your father is maybe not a safe person, maybe that's not a safe thing to do, right? Again, going back to CPS, that could certainly be indicated there. But what are some other behaviors we can engage in that allow you to express that, right? Maybe it's going to like your school's GSA. I don't know, I mean, it would come from the patient, of course, right? But finding alternative behaviors that might be serving a better purpose, right? That's kind of, if I wanted to go with behavioral approach, what I would look at with this. I might also look at like the grades, right? I would look very into the symptoms, right? And then what can we control and what can't we control? We can't control whether your dad is LGBT supportive or not, right? But we can control ourselves, right? 13, you're not going to talk to them like you would an adult, right? But to Chuy's point, sometimes I do a lot of goal setting. What's your goal setting? You want to get out of this damn house? That's your goal? Okay. I wonder if getting good grades might be a pathway to that, right? Well, or what do you think then? Right. So a lot of behaviorism for this, I would want to engage the kiddo in that process, but with that general theoretical undercurrent of let's change the behaviors that are maybe more effective or more supportive of you, right? Because going up and flipping your dad off and telling him I'm, dating Aaron over here and you can't do shit about it, maybe that's not great, maybe that's not an effective behavior or approach that we want to take. Yeah, definitely. Did that help? Did that answer any of those questions? That's how and again, that's how I would do it. Others might have differences. Yeah. Okay. Any other thoughts, questions, comments, motions?
Would it be helpful to kind of talk with her, maybe just get an education on how normal this is for a 13-year-old to have experiences with this? And
I think so. I definitely think that could be helpful, right?
even educating her on like, what's going on in your mind and your body when you're 13 years old?
It could be helpful, yeah. One thing with psychoeducation in general, but especially with kiddos, right? You want to make sure it's obviously developmentally appropriate, which I'm sure you know, but also no one likes to be lectured. So how do we, no. And it's something that I struggle with. How do we, I like to teach clearly, how do we incorporate psychoeducation in a way that it's still receptive, right? So how can I engage her in learning about what her body's going through, what her mind is going through at 13 in a way that doesn't feel like me telling her things, right?
Or like condescending.
Yeah. Like, bitch, I know my hormones are everywhere. They're my hormones. But I do think that could be helpful, right? Because ultimately you're exactly where you need to be. you're 13, you're learning this stuff. You're trying to figure out what you do and don't like. So I like that a lot. Yeah,
Can we explore maybe even the word straight or lesbian and see like what does she fit in with, or what doesn't she fit in with, or like what does she like her opinion on it, like, I don't know if that makes sense.
yeah,
Like this,
definitely.
where she could, if she's having like, this like, she's saying that she doesn't know what to tell her friends about her parent, and just kind of this get her used to maybe this like, this, what does that word mean to me, and how do I do it, and.
Absolutely. Exploration of language, right? It looks like she offered up words like
Mhm.
straight and lesbian, right?
Mhm.
So it seems like you don't know. What about lesbian doesn't work with you,
Mhm.
right? What parts of that don't you like?
Mhm.
You say you also don't know if you're straight. Is there parts of that that you do or don't like, right?
Mhm.
So I like that a lot, exploring what she brings to the table. If it's something that should be open to, again, clinical judgment, something you could do is like, I always love to play like feign ignorance, like, I heard like this word pansexual, but I didn't really get what it meant. I think like I'd kind of heard that you can kind of just love someone based on their maybe personality, but I'm wondering like, is that something you might want to explore? We could even look it up here together. Or if you want to do like a little bit of homework and go look it up on your own time, maybe like in a safe place or something, and we can talk about it next session, right? So obviously we're proposing something, but we're not proposing it, right? I heard this thing. I wonder if that works with you or connects to you, right? And again, letting it come from her, because if she's like, no, I know that is, I don't think that's me, right? Or she might, even if it is her, kids don't like adults, right? I'm not gonna, because you suggested it, I don't want to be, right? But yeah, I think especially with adolescents, that approach of like, we're doing this together. I'm treating you like an adult, developmentally appropriately, but yeah. I like that, exploring the language with her.
I reread it. I think we're missing.
Go ahead.
I think she may have some underlying depression to the point where she's really not eating it.
Yeah,
Then like, maybe SI, you guys try to figure out if the kid is suicidal or not.
Yeah.
But in the history of self-harm.
yeah, I'm glad you brought that up, right? Teenagers already are at higher risk for self-harm. And so we might, especially LGBT teenagers, so we might want to just ask about that regardless, especially with depressive symptoms, she's not eating. So going back to that behaviorism, right? Sounds like you're not really eating a lot. And to Charlotte's point, at 13, we want to make sure you're eating because your body is growing, right? Why, why aren't you eating? But why aren't you eating, right? Is it, just not food that you're interested in, or do you not have an appetite, right? So I think you're absolutely right. A lot of times we want to start with the symptoms, right? Her presenting problem is she's depressed. Why is she depressed? Might be connected to her identity. So a lot of that stuff might play into it. We still got to work on those symptoms, right? We can't do that good, deeper emotional work if kiddos having thoughts of self-harm, right? We can't do that deeper emotional work if we're worried about kiddos' development being stunted because she's not eating. And that can be really dangerous. No one wanted to bring up, like, could that be eating disorder? Potentially. It's really framed in a way that it's probably going to better fit with depression, but you want to ask that too. You want to rule out other things. One thing I might rule out is anorexia, right? Because it says she's not eating. And, what is her BMI, right? I'd look through the diagnostic criteria to see, is that indicated or not? Yeah, so definitely that's something that I'm curious, any about Aaron come up? We're not treating Aaron, clearly. Chewy, you raised your hand.
Yeah, so I was thinking about this to explore Aaron's age. I thought that was important.
Yeah, why might that be important?
The mandated reporting or the clinical judgment. Well, I thought, what kind of threw me off was, if she's 13 and Aaron's 14, but then, Aaron is biologically female, so does that fall into the reporting, the mandated reporting? Because it's talking about sexual intercourse. It doesn't say that she isn't going any further yet.
Yeah. Yeah, so age would be important, right? Because depending on that age, if Aaron's 17, that might be a mandated report, right? 14 is kind of this weird little cutoff age for a lot of things, in terms of like sexual contact and stuff, in terms of what we're mandated to report and not. But that might be important for us to know. How old is Aaron? It doesn't say in here. Now, they haven't done anything sexually beyond hugging, kissing, and holding hands, so, you know, but even if he's, you know, 17, hugging and kissing, and, you know, kissing itself might be something we want to report, right? In terms of the gender, I wouldn't worry about that, right? In terms of if he's anatomically female, it's the age that we want to look at. So even if it's a cisgender woman, let's say she is a lesbian and, you know, it's two women, if, you know, Eliana's 13 and this other woman's 17, that we probably got to report that, right? So, not that gender doesn't matter in life, but for reporting purposes, yeah, you're gonna report regardless of how they identify and stuff. It's gonna be based on that age, right? And then also, you know, Eliana, like if it's like 13 and 14, right? That's gonna be clinical judgment. Eliana is saying stuff is consensual. Doesn't seem like anything's being pressured or forced. If they're the same age, then you're probably not too worried as long as Eliana says she's consenting and stuff, right? Sounds like she is, but I'm glad that you're thinking about exploring that, right? Yeah, one thing that came up for me, you know, Aaron was assaulted at school. Aaron's also a minor, right? He's not here for treatment, so you might be limited, but I might ask some questions like, was anything done by the school? Or, you know, did parents come in to help support Aaron or anything, right? If it seems like not, or, oh, you know, this is the third time it's happened this month, right? That might be a report we need to make as well. Just things to think about. So any other final thoughts on this before we go? I don't think there's any other, I think you guys did wonderful. I don't know that I'd add anything. Yeah, Chewy.
So I guess just by your experience, can you point out the legal and ethical dilemmas?
This is redacted. So there were more legal and ethical dilemmas in there that are not included. One of the ethical dilemmas is the father actually does not have documentation. And so they are undocumented. So one of the things is like, you know, in terms of like ICE and involving authorities making a CPS report, the law is clear what we have to do, right? So we have to do that, but that might be an ethical consideration of how do I then re-engage the family? But that's not included here. The legal mandates are definitely, Eliana, you want to assess for the kill her, right?
Okay.
That's safety, right? That's, is kiddo safe? Is there abuse going on, right? That might be a mandated report. Just in this, again, I pulled out Aaron, that could be, a lot of times the vignettes are written so that you would want to explain how you would follow up to find more information. So for that, I might ask more information about the assault on Aaron, right? Was something done about it? Or how often has it happened? Was this a one-time incident, right? If nothing's being done and it wasn't a one-time incident, things like that might be neglect. And so that might be a report. And then in the vignette, in the write-up, you would then kind of expand step by step the steps you would take, right? Calling CPS, why you're breaking confidentiality, what allows you to do so, stuff like that. Well, those are definitely the legal ones. Ethical concern would be, like I said, the ICE thing that's not included in here. Probably another ethical one would be the family, right, that we talked about, including parents, right? What level do we include parents? Again, pretty clear kids are still the retainers of their confidentiality, so, or their privileged information. So you would not share information with the parents. But again, the part that I redacted out, mom called and wants to know what Eliana talked about, right? That's an ethical concern. We would not share that with her. Could also be legal. So a lot of the legal and ethical and crises can overlap. You want to try to keep them kind of distinct, but it's okay if you say it in both areas. But an ethical concern would be here. Mom is trying to find out information about what Eliana is sharing ethically. We wouldn't want to do that. So good. Does that help you? Yes. Another question, please.
Yeah, so if mom calls and then can you say that I connected from overnight patient there or?
No, she knows patients there. We brought her. Yes, she does have to consent to treatment. 13 is an interesting age. Technically at 12 or older, minors can present themselves for therapy without parents' permission. They are just responsible for the payment now, right? They're bringing daughter, so they know she's coming to therapy. And since they're bringing, again, they are consenting to her being there. So yes, we would disclose, yeah, she's, we can do that. But if she's like, what are you talking about in session? I just want to make sure she didn't report anything that might get ICE involved or look bad on her family, right? And then you just use your wonderful therapeutic report, but the answer is the same. When kiddo shares, I really got to maintain that confidentiality, because if I break that, she's not liable to open up again, right? Yeah. Does that help?
Yeah, no, that helps.
Yes.
So for me, then, let's just say that the 13-year-old was going without, letting, the parents know, how would that differ?
I've never done it, so you'd have to ask more details. My understanding is that, like, if a kiddo at 13 presents to like Fresno Family and they want to seek services, right? We do not need to get parents' consent. Kid can consent for themselves, but they are now responsible for payment. So even if they're utilizing insurance, they're now responsible for the copay on that, right? Now, insurance, I don't know how that works because we don't bill insurance yet. So I'll find out for you. But if kiddos just, I want to pay out of pocket, let's say, they're on like a lower scale, we would just take payment, we would see them. Right? And then trying to think what like the stipulation was with that. The main thing I remember is like if they're presenting with the insurance card, they are now responsible for the co-payment on it, right? So the law just states that they're allowed to consent to services by themselves. So best practice is you still get parents' consents, but if for some reason they're like, my parents can't know I'm coming here, or something to that effect, or I don't know where my parents are, they can consent to services. Likely there'd be other things like I need to report this kiddo doesn't have parents, but yeah. Good question.
Would it be ugly if the parents find out that the kid has therapy sessions without the?
Yeah, would it get ugly? Probably. I can't guarantee it would or wouldn't. Again, legally they're allowed to, so we wouldn't have done anything wrong as long as we documented that. And then how your agency would want to handle that probably be depending on your agency, right? If parents say, no, my kid can't come, and the kid still wants to go, I think they're allowed to. I think that they're still allowed to do that. But that would definitely be a question for a professor. I don't know, but my understanding is they're allowed to present themselves for services. Parents don't have to like it, and they don't have to drive them, like obviously there's a lot of ways it could get messy for the kid. But yeah. Good questions, you guys. All right, anything else before we go? I know it's hot in here. All right, you guys, thank you for everyone who was on Zoom. I'm gonna go ahead and let you guys go for the day. We will be sending this